All right, guys. So I'm going to stream and just do a little commentary. Some thoughts I'm thinking about when it comes to the most current. It's about ready to start the coronavirus. Coronavirus. So I wonder why that didn't show up on there. Right there. Attention. Attention. Sit. Social distancing. Get my hand. That's all screwed up. I never can get it straight. There we go. And I feel like that's crooked. Am I crooked? I guess that's right. Doesn't matter. Bothers me. Bothers me OCD a little bit. So they always start late. This is like watching Nick Fuentes' channel, man. Says he starts at 5, and they always start way late. I haven't watched him forever, but he's wicked late. I don't even want. I'm not going to comment too much on my thoughts right now on this whole thing, other than these are set up to calm everybody down, which is good. It brings a sense of calm. Everyone's just like the president and whatnot. Is everyone's very calm and hey, everything's going to be all right. Everything's good. And then you get away from this for the day and you listen to the media, which is very don't know what to believe, right? You get different reports from all the different agencies. And then you've had me, who's obviously people who know me, or I haven't been doing a lot of videos right now, but people who know me who go to a bit of the extremes, which I don't think are extreme anymore, and we're seeing them unfold, and it's just been kind of hard to the cognitive dissonance that I even myself have been wrestling with. It's like, wow, is this really happening? What we're seeing all roll out in front of us? I am not somebody who's under the impression we're going to be good in 2 weeks or a month. It's not what I feel on this at all. It's not going away. But I'm not panicked and freaked out. But I also got some, I'm a bit prepared for this, so I'm not totally freaking out right now either. If I didn't have supplies and whatnot, I might be a little worried. But it's kind of pointless to try. It's kind of pointless to be worried, I guess, a little bit. Read some of the chats. Hello, what's up, Jack? What's up, Abandoned? Randy, what? Late again. Yep. Jack, my life is being run through the grease over a Freemasonic gag. Yeah. Is this from the White House? Yeah, this is from the White House. This is Time, but this is going to be from the White House. Yeah. Deborah, he was to start at 11:50. You maybe 12. Yeah. We got 3 minutes till 11:50. So, but they've been consistently running late every damn day. So it'll be interesting to see. The social distancing thing's kind of. I get it, but it's like if you have this many people in here, if any of them are infected, it doesn't matter if you're sitting one chair away from one another. Marks, I have supplies, but not for 18 months. Oh, you just read the whole 18-month thing too, huh, Mark? I just read that yesterday too. Did you read off of Zero Hedge? That Zero Hedge article? See, I'm trying to balance back from Zero Hedge and natural news articles, which are, this is completely the end of the world, which to the other side where it's like, okay, this is just going to be bad for a few months. I'm trying to find the balance somewhere in between, but society breaks down. It breaks down very quickly. Whatever you think about this coronavirus, whether you think it's legit or you think it's a hoax, all of that is a little bit irrelevant at this moment where we're at right now. We're going to have time to get our brains around that and wrap around if that is here in the next coming days and push back on that or figure that out, right? And there will be some telltale signs whether or not when we start seeing who actually gets better from this and what the consequences are to them once they've gotten better from this, right? What's the lung tissue damage that's been done, even if you do survive? So we talk about 80% people who survive, right? Well, what we're not talking about or touching on is the ramifications to people who survive, right? And then we don't really know all the numbers yet. Now they're coming out and saying the young can get it, right? I have been thinking the young could get it from the beginning. Here they go. So we'll talk a little more about it afterwards, but let's listen to what they got to say here. Oh, Pompeo's there. Huh. He hasn't been there. Where's the president at? Dun, 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 dun. President. El Presidente. I bet they were back there getting coached up on how each one of those guys have got to, every time they talk, say how good the president's doing with this job, which I'm not saying he's doing a bad job with it. I think he's doing the best he can. But they are going to make a lot of comments about where's Pence and why is Pompeo here? Huh. Okay. Awkward. It's like you walk into a restaurant, wait to be seated. You can say your waiter will be with you in a moment. Something. No, I don't think, personally, I don't know enough about the Q plan. Okay. So anything's possible. But no, personally, if you're asking me, do I think this is part of the plan just to get everyone arrested and bring, I think it's part of the plan to crash the economy.
Thank you very much.
Okay.
I had a very good telephone conversation, extremely good with Senator
quiet.
Schumer a little while ago. We're working on various elements of the deal, and the Democrats are very much wanting something to happen, and the Republicans likewise are very much wanting something to happen. And I think it will. I spoke with at length with,
I'm going to find a louder one.
and there's tremendous spirit to get something done, so we'll see what happens. But my conversation was very good with Senator Schumer.
He's really quiet.
I thank you all for joining us, and I'd like to begin by providing an update on what we are doing to minimize the impact of the Chinese virus on our nation's students. With many schools closed due to the virus, the Department of Education will not enforce standardized testing requirements, very importantly, for students in elementary through high school for the current year. They've been through a lot. They've been going back and forth, schools open, schools not open. It's been all standardized testing, and it's we're not going to be enforcing that, so I think you can let the people know. I think probably a lot of the students would be extremely happy, some probably not. The ones that work hard, maybe not, but it's one of those things. Unfortunate, very unfortunate circumstance. We've also temporarily waived all interest on federally held student loans. They'll be very happy to hear that. And I've instructed them to take that action immediately. And today, Secretary DeVos has directed federal lenders to allow borrowers to suspend their student loans.
All of these small businesses trust Next
without
Insurance.
penalty for at least the next 60 days. And if we need more, we'll extend that period of time. Borrowers should contact their lenders. And I've instructed them to take that action. Temporarily waived all interest on federally held student loans. That's a big thing. That's going to make a lot of students very happy. And we have more to come on student loans, more good news for the students, but we'll do that at a different time. This morning, the Treasury Department also announced that we're moving tax day from April 15th to July 15th, so we're moving it out to July 15th so that people will have time and people will be able to, hopefully by that time, we'll have people getting back to their lives. Families and businesses will have this extra time to file with no interest or penalties. We're getting rid of interest and penalties. However, if you have refunds or credits you would like to claim, you may still file. In other words, you can file early if you are owed money by the IRS. Other than that, we're moving it all the way out to July 15th. No interest, no penalties. Your new date will be July 15th.
Can you guys
There,
hear
our
okay?
team will also provide
Is
an
it too
update
quiet?
on our continuing effort to prevent the transmission of virus across America's borders. And I watched what's been happening in California with Governor Newsom and this morning with Governor Cuomo, and I applaud them. They're taking very strong, bold steps, and I applaud them. And we're all working together. We're working very closely together, including those two governors. But I would say, based on the call, the media was there. We can say that with respect to virtually every governor on that call. I think every governor. We had almost all of them, if not all of them.
Okay.
And I would say that you could see for yourselves that the level of respect and esprit de corps working together was extraordinary. There was nobody angry, nobody upset. We're able to help them, and that's what we're all about. We want to help. We're doing things that a lot of people wouldn't be able to do. But the relationship with governors and states is, I think, very extraordinary, especially under the circumstances where this just came upon us. We're working with Canada and Mexico to prevent the spread of the virus across North America very closely. You heard what we did yesterday with Canada. And Secretary of State Pompeo will be making a statement in a little while having to do with Mexico and the border. And Chad Wolf will likewise be making. We're working with Canada and Mexico to prevent
Okay,
the
this is
spread of
better
the
when we
virus
do
across
this,
North
guys.
America very closely. You heard what we did yesterday
I'm
with
just going to
Canada.
close out for a second.
And Secretary of State Pompeo will be making a
Stay
statement
with me. It's
in a
coming
little
right
while
back.
having to do with Mexico and the border. And Chad Wolf will likewise be making a statement. There's a joint comprehensive effort in collaboration with our
louder.
neighbors. The measure and all of those measures that we're putting in place will protect the health of all three nations and reduce the incentive for a mass global migration that would badly deplete the healthcare resources needed for our people. And so we are working very closely with Mexico, very, very closely with Canada. The relationship's never been better. We're all working for toward the same goal. Our nation's top healthcare officials are extremely concerned about the grave public health consequences of mass, uncontrolled cross-border movement. And that would be mostly, and even beyond, but mostly during this global pandemic. Every week, our border agents encounter thousands of unscreened, unvetted, and unauthorized entries from dozens of countries, and we've had this problem for decades. For decades, you know the story, but now it's with the national emergencies and all of the other things that we've declared, we can actually do something about it. We're taking a very strong hold of that. And we have before, but this is now at a level that nobody's ever approached. In normal times, these
Doesn't he
massive
seem
flows
so
place a
subdued?
vast burden on our healthcare
Subdued?
system. But during a global pandemic, they threatened to create a perfect storm that would spread the infection to our border agents, migrants, and to the public at large. Left unchecked, this would cripple our immigration system, overwhelm our healthcare system, and severely damage our national security. We're not going to let that happen. So
Kind of already happened.
we have a lot of information, and they'll be discussing that in a moment. To confront these public health degrees, the Centers for Disease Control and Prevention has decided to exercise its authority under the Title 42 of the U.S. Code to give Customs and Border Protection the tools it needs to prevent the transmission of the virus coming through both the northern and the southern borders. So we're treating the borders equally, the northern border and the southern border.
You have to say that,
It's
otherwise
being
people
treated-
think
they're
he's
both being
racist.
treated equally. A lot of people say that they're not treated equally. Well, they are. As we did with Canada, we're also working with Mexico to implement new rules at our ports of entry to suspend non-essential travel. These new rules and procedures will not impede lawful trade and commerce. Furthermore, Mexico has taken action to secure our own southern border and suspend air travel from Europe. So we're coordinating very closely with the air travel going to Mexico and then trying to come into the United States. The actions we're taking together with our North American partners will save countless lives. At the conclusion of my remarks, Secretary Azar, Secretary Pompeo, Secretary Wolf, we're going to be also taking some questions with Tony and Deborah, who you've gotten to know very well. But they'll be discussing certain things, and I think you'll find them of great interest. We're going to be providing tremendous amounts of detail over the coming days, but a lot of it will be provided right now if you'd like to find out about it. There's been a week of resolute action, tremendous relationships have developed with people that frankly didn't get along, people that didn't like each other. They're now working together and maybe even in some cases learning about each other and liking each other. It's a nice thing. I invoked the Defense Production Act, and last night we put it into gear. We moved the National Response Coordination Center to the highest level of activists. I mean, if you take a look at what we did, the level of activation has been increased to a grade 1 level, which is the highest level. We're providing historic support to small businesses and to the states. The states need support. Normally, they do this themselves, but because of the magnitude of it, the federal government has gotten very much involved in terms of getting the equipment they need. So we're helping them. It's a responsibility they have, but we are helping the states a lot. That's why the governors, I think, in every case have been impressed and very nice. We enacted legislation guaranteeing paid sick leave for workers at no cost to employers. And I think it's very important. So they get paid sick leave at no cost to employers. We're accelerating the use of new drug treatments. We're advancing legislation to give direct payments to hardworking families. Throughout our country, Americans from all walks of life are rallying together to defeat the unseen enemy striking our nation. In times of struggle, we see the true greatness of the American character, and we are seeing that. A lot of people are talking about it. We're at 141 countries from what they're telling me, and some of those countries are really working in a unified manner, and they're working very unified with us, almost, I could say, a good number of them. Doctors and nurses are working nonstop to heal the sick. Citizens and churches are delivering meals to the needy. Truckers are making the long haul to keep shelves stocked. We've been dealing with the big stores and the big chains, Walmart. They've been fantastic, and others. They've all been fantastic. We've made it much easier for them to stock in terms of travel and travel restrictions. We're lifting restrictions so they can get their trucks on time. You're seeing very few empty shelves, and yet the amount of volume that they're doing is unprecedented because people want to have what they have to have, what they feel they have to have. And they're also buying in slightly smaller quantities, which is good because we're not going anywhere. We're going to be here. So I want to thank all of those very great companies for working so well. Americans from every walk of life are coming together. And thanks to the spirit of our people, we will win this war. And we're winning, and we're going to win this war. America will triumph, and America will rise higher than ever before. We'll be stronger than ever before. And we've learned a lot. We've learned a lot. We've learned a lot about relying on other countries. And I can say that I think in both a very good and a very bad way. Some good things came out of it, and some not so good things came out of it. So I'd like to move now to invite our team to provide information on the new measures to prevent viral spread at our borders. And I'll start by asking Secretary of State Pompeo to speak. He's doing a fantastic job, and like everyone else, he's been working very, very long and very, very hard, and he's doing the other more normal jobs of a great Secretary of State. But he got tied into this like everybody else, and he's been really doing a fantastic job. Mike, please.
Thank you, Mr. President. Before I address the efforts that we've been engaged in to push back against the Chinese virus. I want to assure the American people that, as President Trump just said, your State Department, your entire national
Chinese
security
virus.
team is staying focused on the other diplomatic challenges around the world. Those include reducing risk to America from Afghanistan, holding the Iranian regime accountable for its malign activity, and
great.
our counterterrorism efforts against ISIS remain a priority for our team. Our number one priority across those mission sets remains the protection of the American people. The President and our team are very focused on it. I'll take this moment, too, to thank my team, State Department team, who is working long hours all around the world to take care of Americans who are stuck at places around the world. I'll talk about that more in just a minute. You've all seen Dr. Birx with me, State Department official who's doing great work, but I want to give a shout out to all of the State Department team here in Washington and around the world that are working overtime to help us push back against this pandemic. Under the President's leadership this week, we've taken two important steps. First, as President Trump announced on Wednesday, the United States and Canada jointly agreed to restrict all non-essential traffic across our border.
It's a slow rollout,
This
guys.
decision
They're just
goes into
locking
effect tonight at
everything down,
midnight.
little by little.
The restrictions will be reviewed after 30 days, and they exclude traffic and movement across the border for work or other essential reasons. We're grateful to have such an outstanding friend to the north who is committed, as we are, to defeating this virus. I also want to announce today that the United States and Mexico have agreed to restrict non-essential travel across our shared border. Both our countries know the importance of working together to limit the spread of the virus and ensure that commerce that supports our economy continues to keep flowing. Here, too, the United States is glad to have a friend who's working side by side us in the fight. Secretary Wolf will talk a little bit more about the details of how we're working alongside our partner in Mexico to keep our southern border safe and secure as well. On another note, yesterday the State Department issued a Level 4 global travel advisory. This means that all international travel from U.S. citizens should be avoided.
Glad to have you,
In
Tyler.
countries where commercial departure options remain available, U.S. citizens who reside in the United States should arrange for immediate return to the United States unless they're prepared to remain abroad for an extended time. If you choose to travel internationally, your travel plans may well be severely disrupted. And finally, I want to talk about the disinformation that people are seeing, both on Twitter and around the world, some of it coming from government, some of it coming from other individuals. Just urge everyone, as they're seeing information that at one time suggested somehow this virus emanated from the United States Army, this information about lockdowns that are taking place. Every American, indeed people all around the world, should ensure that where they turn to for information is a reliable source.
Here we go.
And not a bad actor trying to create and flow information that they know
See what they're
is
doing
wrong.
right there?
This is a tough fight. The American people are tougher. Our diplomatic teams are working around the clock
They're
to help
setting
them
up
keep
that-
safe both home and abroad. And we're showing once again the global leadership that America has always delivered. And it's been great to see countries around the world rally behind what President Trump and our team are doing.
So right there, he was setting up the media. Like you got to trust
We'll
the
take
you got to trust the right
questions right after
sources.
this.
They've been rolling that out
Chad
for
Wolf, yes?
they've been rolling that out for a while because they're
Well, let
probably
me start
gonna
off by thanking the
silence people
President
like
and the
me.
Vice President for their continued leadership and commitment for protecting the American people during this crisis. Early on, the President, again, took unprecedented actions to restrict travel from areas affected with the coronavirus. And to date, DHS has screened over 200,000 individuals coming back from those affected countries. This has been an immense undertaking, but one that the men and women
don't
of
think it's the food,
DHS
Jack.
have successfully accomplished. Today's announcement is yet another example of the extraordinary steps the administration is taking to ensure the safety of the American public.
There is another agenda.
Before I
you're right.
comment on the CDC order that I'm sure Secretary Azar will later elaborate on, let me first address the progress as Secretary Pompeo and others have made with our Canadian and Mexican partners regarding cross-border travel. As we continue to evaluate common sense measures that reduce risk and prevent further spread, it only makes sense that we have looked at the measures that our neighbors to the north and south are undertaking. And so we've been working closely with those partners since the earliest days of this virus and the outbreak. And again, as the President said earlier this week, and Secretary Pompeo, we've reached an agreement with both Canada and Mexico to limit non-essential travel across our land borders. Let me be clear that neither of these agreements with Canada or Mexico applies to lawful trade or commerce. Essential commercial activities will not be impacted. We will continue to maintain
Yeah,
a
this is
strong and
crazy.
secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services, and individuals engaged in lawful cross-border trade. As the Secretary said, the agreements with both Canada and Mexico will go into effect on Saturday, March 21st. Furthermore, we're also working collaboratively with Canada and Mexico to take decisive joint action regarding individuals seeking entry between our ports of entry. The CDC order directs the department to suspend the introduction of all individuals seeking to enter the U.S. without proper travel documentation. That's for both the northern and southern border. The CDC director has determined that the introduction and spread of the coronavirus in the department's border patrol stations and detention facilities presents a serious danger to migrants, our frontline agents and officers, and the American people. So it's important to note that the department currently apprehends foreign nationals from over 120 different countries around the world, the vast majority of those having coronavirus cases. Many of these individuals arrive with little or no identity, travel, or medical documentation, making public health risk determinations all but impossible. It's also important to note that the outbreak on our southern border would likely increase the strain on health systems in our border communities, taking away important and life-saving resources from American citizens. Tonight, again at midnight, we will execute the CDC order by immediately returning individuals arriving without documentation to Canada, Mexico, as well as a number of other countries without delay. And so, again, CBP is positioned to execute these measures as we continue to keep our borders secure and safe. Before I conclude, let me just wrap up by thanking the brave men and women of DHS, specifically CBP, and across the government for the work that they do day in and day out to keep the American people safe from the coronavirus. The department has a number of frontline officers that have tested positive, as well as others who are self-quarantining, and that I am doing everything that I can to protect these patriots as they continue to defend our homeland during this crisis. Thank you.
Thank you very much, David. Thank you.
Yeah, background checks are down. Yeah, that makes sense.
Today's announcement is just the latest in a long line of bold, decisive actions the President has taken to protect Americans from the coronavirus spreading across our borders.
Find it interesting.
In January, within 2 weeks of China's notifying WHO about the virus, and with only 45 cases in China, we began screening travelers from Wuhan. Then, over time, as the outbreak evolved, the President restricted travel from China, Iran, and Europe. Our health experts say that these measures have been truly effective at slowing the virus's spread to our shores. Just think about this. Italy and the United States both saw their first travel-related case of coronavirus around the exact same time, the last week of January. And yet we have had precious time to continue our work around vaccines, therapeutics, and other preparations, while Italy has tragically been overwhelmed with critical patients for several weeks now.
What you can do.
The President today is taking action to slow the spread of infectious disease via our border.
Vitamin A,
Under Section
vitamin C,
362
and build
of the
your
Public
immune
Health
system.
Service Act, the CDC is
It's a good thing
suspending
to
the
do.
entry of certain persons
In general.
into the United States
Start
because
really
of the
building it
public
right
health
now.
threat that their entry into the United States represents. This order applies to persons coming from Mexico and Canada who are seeking to enter the country illegally and who would normally be held in a congregate setting like a Customs and Border Protection station. It does not apply to U.S. citizens or lawful permanent residents. During this pandemic, a number of health challenges arise when illegal immigrants arrive at our northern and southern borders and are taken
such a
into
racist thing
immigration
to say.
custody. We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. When held at border facilities, these migrants risk spreading the virus to other migrants, to CBP agents and border healthcare workers, and even the United States population as a whole. In such circumstances, the kind of social distancing measures the CDC and the President have recommended are simply not possible. On top of that, any resources that we are using to reduce the risk of infection among CBP agents, healthcare workers, and migrants in these facilities are drawing on an American healthcare system that is already fighting the coronavirus pandemic. That's why the president and his administration are taking these important steps to keep Americans and our immigration system safe from these health risks as part of our whole of government approach to combating the coronavirus. Thank you, Mr. President, for the work that you've been doing throughout this crisis to slow the spread of the coronavirus and to keep our country safe.
Thank you very much. Thank you. Tony or Deb, please.
Thank you, Mr. President. So we continue to review the data very carefully from around the globe, as I know many of you are. We continue to see signs that, again, individuals under 20, 19 and under may have severe disease, but majority and all have recovered to date. We still see that same trend. And frankly, from Italy, we're seeing another concerning trend, that the mortality in males seems to be twice in every age group of females. This should alert all of us to continue our vigilance to protect our Americans that are in nursing homes. This requires all of the community, and when you see the sacrifices that many Americans have made, the sacrifices that the service industry has made
women.
to close their
That doesn't seem
restaurants,
fair.
close their bars, and so that the spread is discontinued, and then you really understand how all of Americans must make the same sacrifice. We continue to ask you to follow the presidential guidelines of no groups coming together of more than 10, that if anyone in the household is sick, that everyone quarantines in the household together, and that we continue to focus on those who have the most vulnerability to this illness. Now, to the moms and dads out there that have children with immunodeficiencies or other medical conditions, we don't know the level of risk, and I know you will also protect them in the same way. There just is not enough numbers at this time to really tell them if they're at additional risk or not in the same way that adults are. I don't have any new data. I can see the look on your face of saying, is she seeing something new? I don't have any new data, but I think it's important for us to be as honest with the American people as we can. And when we don't have data, be very clear that we don't know. Finally, no one is immune. I sometimes hear people on radio or others talking about, I'm immune to the virus. We don't know if the contagion levels are different in age groups, but we know it's
Still getting
highly
over.
contagious to everyone. Do not interpret mild or moderate disease as lack of contagion or that you're immune. You just happen to have a better immune
Right,
system.
Tyler.
And the ability to fight the virus in
Yeah.
a way that maybe older people
Exactly
or
can.
people with existing medical conditions
Brownie
can't.
points.
And that's why it's very important at this moment that all of you carry that message about the sacrifices that many have made, particularly our service providers and our frontline healthcare workers. They are making that sacrifice every day so that every American can move through this well. But we need every American following the presidential guidelines. Thank you.
Thank you very much. Tony, please.
Thank you very much, Mr. President. I just want to underscore a couple
Someone
of
get him
things
a
that I've said
stool.
a few times to this group. You may recall that just a week ago or so, I said the two pillars, the two elements of our capability to contain the infection and the surge of infections in this country rely on two things: keeping infections from coming from without in. We've been very successful in doing that with China and with Europe. Now we have the northern and southern border issues. There's a fundamental public health reason for doing that, because we cannot be preventing people from coming in from one area when they can actually go into the other. So that's an important reason. Understand that there's
You
a
think?
public health reason for doing that.
Haven't we been saying
The
this before
second
there was a
thing
virus
I
too?
think is really important is what happened in New York today, what Governor Cuomo
No, he's
mentioned
not,
about an
Tyler.
hour ago, some rather strong issues that have been addressed with his recommendations. Not recommendations, essentially orders. Now, we have a group of recommendations and guidelines that are applicable to the entire country. You know them. We've been over them. Yet there are places, regions, states, cities in this country that are being stressed much, much more than the country as a whole. Clearly, one of them was Washington. Another one was California. Governor Newsom made some very important, difficult decisions. Today, Governor Cuomo did the same thing.
Ooh,
and I want to
I didn't
say
hear
I
that yet.
strongly
So Cuomo locked it
support
down.
what he's doing. And one thing, as a New Yorker myself, for those of you who haven't figured out from my accent that I'm from New York, as a New Yorker, I know what New Yorkers can do. We're tough. I was in New York City on September
called
11,
that. I said before
2001.
Friday they're locking
and
down
I know
by
what the
Friday.
New Yorkers can do. So please cooperate with your governor, cooperate with your mayor. It's very important. Thank you.
That city's going to burn. I'm just saying. How do you lock?
Thank you, Mr. President.
That's crazy.
The White House Coronavirus Task Force met this morning. We continue at the President's direction to bring the full resources, not just of the federal government, but in full partnership with our state governments, businesses around America, and a partnership with the American people to respond to the threat of the coronavirus. And I know I can speak
taking
on
my
behalf
steps,
of the
Dale.
President with confidence when I say how inspired we are by the way the American people and American businesses are coming together to help defeat this virus in our country. Millions of Americans are putting into practice the President's 15-day guidelines, and we encourage everyone, even those that are not in areas with significant outbreak, to review these guidelines over the next week and more and put them into practice, and you'll continue to do your part. Later today, we'll be talking with manufacturers around the country, and the President and I continue to be
It's
inspired by
already
the way
kinda starting,
American
Big Sky.
industry is stepping forward. We have businesses around the country that
Looting
are
is
literally
already kinda starting
volunteering
to
to
kick off.
retrofit plants to help us meet the needs of our healthcare workers and our healthcare system in confronting the coronavirus. As the President mentioned yesterday, following his decision to put FEMA in the lead,
And it's
the
gonna just
emergency
get way worse.
declaration, we actually met with all the nation's governors from the FEMA National Response Coordination Center. The President and I, our entire team at the federal level, couldn't be more grateful for the efforts
good,
of
Tyler.
all of our governors in implementing the guidance that is being issued, not only from our task force, but also in taking strong measures in their own communities to protect their citizens. We want to urge every American to heed your local authorities, listen to their guidance, and also do your part to slow the spread. We reiterated to all of the governors that the President, by putting FEMA in the lead, will continue to implement a plan that is locally executed, state managed, and federally supported that puts the health of America first. We have received a report today, as the President mentioned, on our legislative team on Capitol Hill. We're working with Republicans and Democrats at this very hour to pass an economic recovery package that the President described.
Okay, guys,
We
but
hope to
here's the
see
thing
the
about
Congress
that.
act on that
People don't
early
realize you
next
can't
week.
just make
On the
print money
subject
out
of
thin air and
supplies,
give
we
it
continue to
everybody
make
and
steady
expect that it doesn't
progress on
seriously
testing,
hurt our
thanks to the
economy.
President's
I mean, or, you know,
involvement of commercial
it's-
labs, the
it's
public and
hyperinflation.
private partnership.
turns
More
us
and
into
more
Venezuela
Americans are being
by
tested
just printing
every
money
single
and giving it
day.
to people.
And tomorrow, Admiral Gua and FEMA will update the American public on the status of testing and our support of state-based testing
Yeah.
efforts that are literally expanding by the hour. On the subject of medical supplies, we continue at the President's direction to pursue every means to expand the
You're welcome.
supply of personal protective equipment
You're welcome to offend
for the
people here, Tyler.
extraordinary and courageous healthcare workers that are ministering to the needs of people impacted by the coronavirus. We have a policy of procuring, allocating,
Ken,
as
that's
well as
funny. It's true, though.
conserving the resources that we have in our system. And now that the President worked with the Congress to make industrial masks fully available for hospitals to be able to purchase, to be able to use as protective equipment, we're more encouraged than
better?
ever
Can you guys hear me
about
now?
the availability of those important N95 masks
Check
to
one,
our healthcare
check 1, 2.
facilities.
Can
And
you
over
guys
this
hear me
weekend,
okay if I want to talk
we'll
over
be
it now?
announcing a major procurement from the federal government of N95 masks as well. We're also encouraged that we're finding new alternatives to increase the
good.
supply of ventilators. We've mentioned that we have a federal stockpile, some 20,000 ventilators on standby, but that doesn't count the tens of thousands of ventilators that are in our healthcare system around the country. But the President has challenged us to work to free up other ventilators from other sources around the country. And there are two different ways that we're doing that. Number one In our recent discussion with anesthesiologists, we've literally identified tens of thousands of existing ventilators that can be retrofitted and converted to be ventilators for people struggling with the coronavirus. But also, on the President's behalf, on behalf of all of our task force, we want to continue to urge every American and every American hospital and healthcare facility to postpone any elective medical procedures.
I turned up my mic.
This will free up bed space, free up hospital capacity for people that are struggling with the coronavirus, and it'll also free up equipment that our healthcare workers need. It is inspiring that we continue to receive reports that businesses around America are donating N95 masks to their local hospitals. Businesses large and small are donating hundreds, in some cases millions of N95 masks. And I know how grateful the President is, and we all are. And let me close by saying, as all of our experts have said many times, while the threat of serious illness to the average American from the coronavirus remains low, every American can do your part to reduce the burden on your health, on your family, the burden on our healthcare system, and especially the threat to the most vulnerable among us by putting into practice the President's 15 days to slow the spread. And as the President said at the outset of his remarks, I know that millions of Americans are doing that just now, and the greatness of the American character is shining through.
I don't know anybody yet who has it. I know somebody, a good friend of mine got tested for it. I'm going to find out here if he got it.
Thank you. Go ahead.
You had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So 2 questions. Is that what you're doing now?
It is. I did it yesterday. We invoked it, I think, the day before. We signed it the evening of the day before, and invoked it yesterday. We have a lot of people working very hard to do ventilators and various other things. Yes.
So you're using it now to tell businesses
We are
they need to
using
make
it.
ventilators, masks, respirators?
For certain things that we need,
Okay.
including some of the very important emergency. I would say ventilators, probably more masks to a large extent. We have millions of masks which are coming and which will be distributed to the states. The states are having a hard time getting them, so we're using the Act. The Act is very good for things like this. We have millions of masks that we've ordered. They will be here soon. We're having them shipped directly to states.
So you said you were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst case scenario. So are we now at a worst case scenario?
What do you think, you moron?
Well, it's no different other than we need certain equipment that the states are
dumbass.
unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they
Just
need,
get a
like the
soundbite.
masks, like the ventilators. Yes, Steve?
Governor Cuomo has done in New York, is there any more consideration to a national lockdown to keep people in their homes?
I don't think so.
I don't-
Essentially, you've done that in California. You've done that in New York. Those are really 2 hotbeds. Those are
I don't
probably
think
the
so.
2 hottest of them all in terms of hotspots. I don't think so, because you go out to the Midwest, you go out to other locations, and they're watching it on television, but they don't have the same problems. They don't have by any means the same problem. New York, California, Miami, the governor's doing an excellent job. Governor DeSantis in Florida.
Not
We
when
have some pretty
society
hot spots
completely
in
breaks
Florida
down.
too. But we're and the state of Washington, of course. But that was largely, if you look at it, it was one nursing home that had problems like you wouldn't believe. So no, we're working with the governors, and I don't think we'll ever find that necessary.
We're about a week into your 15-day guidelines. Are you happy with the progress? Would you like to see?
I am
15
happy.
days
I am
extended?
happy with it. We'll have to see what the results are at the end of 14 days, let's say. We'll know by the 15th day to see what we do. But I'm certainly honored by the way the American people are working, because it's work. It's work not to work. This is the first time this has ever happened. And we're working out a tremendous financial package for them so they don't work. Who ever heard of this? Usually you work out a financial package to get people working. We're asking people not to work. Social distancing, a new term that's become probably the hottest term there is. So, no, I'm very honored by the way the American people are taking this, I mean, so seriously. Yes, John?
Mr. President, a question for you and a question for Dr. Fauci, if I could. There's been some concern among Democrats on Capitol Hill that the Phase 3 fiscal stimulus is weighted too much in favor of corporations and not enough in terms of individuals. What did your conversations with Senator Schumer yield on that front?
Well, I think that really all of that is being discussed right now. We talked about, as an example, buybacks, stock buybacks. I don't want to have stock buybacks. I don't want people spending, I don't want some executive saying we're going to buy 200,000 shares of stock. I want that money to be used for the workers and also for the company, to keep the company going, but not for buybacks. I would, I mean, I haven't spoken to a lot of the Republicans or Democrats on it. We discussed it, and I don't like buybacks. I didn't like them the first time.
Are you and Senator Schumer?
So
on
we're
the same page?
discussing that. We're discussing many
Are
things.
you on the same page with Senator Schumer?
We're not so far away. I'll tell you, we're not very far away.
And to Dr. Fauci, if I could. Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential
hear
therapy
about
for
this.
people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Mr. President, on that on those therapies.
I think I'm, without seeing too much, I'm probably more of a fan of that than maybe than anybody. But I'm a big fan, and we'll see what happens. And we all understand what the doctor said is 100% correct. It's early, but we've, you know, I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety. But, you know, when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug. So we'll see.
Fairly effective against SARS.
It was, as I understand that, is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals.
Wow, disagreement in the ranks right there, guys, with Fauci.
To compare it to.
Yeah, well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care.
Wow, he
plus
doesn't
the
have any
agent you're
problem-
evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Doesn't want to show any hope there.
About the possible therapies, yesterday, Mr. President, you said that they were
I'm going
for,
to cover
quote,
these things when we're
immediate
done. I want
delivery
to hear what they're
immediate.
saying,
We
and
heard
then
We're
we're going to
ordering,
go over this
yes,
stuff.
we have
I'm making notes.
millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company.
Fantastic
Millions of
company.
units are ordered, and we're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs, and we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units.
That's a good point, Kenneth.
It's being ordered from Bayer, and there is another couple of companies also that do it.
For clarity, Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
Well, you know, I think we only disagree a little bit.
Sorry.
I disagree. Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it
We're gonna
possible?
know.
Is it
Division
possible
in the
your
ranks
impulse
right
to
there.
put a positive spin on things, maybe giving Americans a false sense of hope?
No, I
and
don't think so.
misrepresenting
I
the
don't think
preparedness
so.
right now?
No, I don't think so. I think that, I think it's got, no, I know.
The not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we
Look
have
at that
certainly
biatch
some
in the
very big
background.
samples of people. If you look at the people, you have a lot of people that are in big trouble. And this is not a drug that obviously, I think I can speak from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been
We're
some
shutting
interesting
everything
things
down over
happening,
this.
some
Why
good-
can't we
very good things.
go out on a ledge on
Let's
that one?
see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So what do you say to Americans who are nearly 200? I'll just follow up.
John,
Nearly
go
200
ahead.
dead. What do you say to the Americans who are scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead.
I
I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast. I call it Concast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
I agree with
science
Trump. I agree with Trump on that one.
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population?
We are going to, as I understand it, we are going to be taking samples in New York. Governor Cuomo very much is interested in this drug, and they are going to work on it also after they get a certain approval. We're waiting for one final approval from the FDA. We'll see what happens. But we'll use it on people that are not doing great, or even at the beginning of not feeling well.
Sort of fall under the.
And John, what do we have to
modified
lose?
auspices. So this would sort of.
Wait, John, it's been out there for so long. We hear good things. Let's see. Maybe it works and maybe
Fauci
it
doesn't
doesn't.
agree with him at all, man.
Just
So
thinking
there's
the
some division
application,
behind
so
the ranks
would
on
be
that
Sort of
one.
a modified compassionate access.
We're doing that, I guess, and that's what it's called, yeah. Yes.
I would like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now? And sir, I would like to follow
She's
up on Peter's question
exploiting
here.
the division
Could you
right there.
please
She can see it
issue,
too.
Address Americans in this country who are scared right now. This is a very valid concern that people have.
No, there really isn't that much of a difference in many respects with what we're saying. The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the
President is
toxicities
tired.
are rare
Yeah, Dale, you're
and they
right.
are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe, but I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who
agree.
are working at home, who have their children in their homes right now, who
Here
are
we go. Go
homeschooling,
ahead.
doctors who say they don't have the masks they need to do their jobs, your message to them.
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's looking like it's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better country than we were before. And we learned a lot. We learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back.
I don't
please.
see that happening. I'm not trying to be a downer, but
The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take.
We're going to be helping them a lot. We're going to be focused, a big focus, and including my conversation with both Mitch and with Chuck, a big focus of that conversation with small businesses, because they are really the engine behind our country, more so than the big ones. They are the engine behind our country.
Second, if I may, sir, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
I'm not aware of it. I saw some names. I know all of them. I know everyone mentioned Dianne Feinstein, I guess, and a couple of others. I don't know too much about what it's about, but I find them to all be very honorable people. That's all I know. And they said they did nothing wrong. I find them, the whole group, very honorable people.
wait a
Yeah,
minute.
please.
Wait a minute, guys.
So the whole group would include Richard Burr, the
Feinstein,
head of the
honorable?
Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or
this
not
one
they should
he's-
be investigated for that behavior.
Well, it also includes Dianne Feinstein, a Democrat. You didn't mention her name. Why didn't you mention her name? And I think she's a very honorable person, by the way. So I'm not saying, but you know, it's
Any
interesting
senator,
that you
any
mentioned
senator,
two
so-
people, but you don't mention one that happens to be a Democrat.
Any senator, should they be
I don't know, because I'd
investigated
have
for
to
this
look at it, possibly, but I find them to be honorable people. Yeah.
You said the other day you
I don't like those
consider
answers
yourself-
right
you see yourself
there.
as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, going off on Peter, going off on a network is appropriate when the country is going through something like
I
this?
do, because I think Peter is, I've dealt with Peter for a long time. And I think Peter is not a good journalist when it comes to fairness.
But he's asking for your message to the country.
Oh, I
and
think
you
it's a
went
good
off on
message,
Peter.
because I think that the country has to understand that there is indeed, whether we like it or not, and some of the people in this room won't like it, there's a lot of really great news and great journalism, and there's a lot of fake news out there. And I hear it all, and I see it all, and I understand it all because I'm in the midst of it. So when somebody writes a story or does a
Yeah.
story on television, and I know it's false, I know it's fake, and when they say they have 15 sources have said, and I know there's no sources, they're just making it up. I know that, and I call Peter out, but I call other people out too. And, this is a time to come together, but coming together is much harder when we have dishonest journalists. It's a very important profession that you're in. It's a profession that I think is incredible. I cherish it. But when people are dishonest, they truly do hurt our country. Yeah, in the back. Please, go ahead.
Mr. President, China has been in communication with the United States and also WHO about coronavirus
Right,
in
that's true.
January.
That's
and
true.
the U.S. shut its border to travelers from China on February the 2nd. Also, Wuhan has been in lockdown since January the 24th. And this all happened almost 2 months ago. Why did you still say if you could have known it earlier? And also, you have been calling coronavirus.
Well, I have to say this, we have, and I can speak for
now
myself.
they use the
but
now they use the
I have a very good relationship
Chinese chick.
with China and with President Xi. I have great respect for President Xi. I consider him to be a friend of mine. It's
What?
unfortunate that this got out of control. It came from China. It got out of control. Some people are upset. I know President Xi. He loves China. He respects the United States. And I have to say, I respect China greatly, and I respect President Xi. Okay?
Calling coronavirus.
Can I ask more about stock buybacks? Many of the airlines and Boeing did stock buybacks. Is this a deal breaker for you in this?
No, but it's,
She
I never
tested.
liked stock buybacks from their standpoint. When we did a big tax cut, and when they took the money
Yeah.
and did buybacks,
I think you're
that's
right,
not
Mark.
building a hangar, that's not buying aircraft, that's not doing the kind of things that I want them to do. And we're now talking about buybacks. We didn't think we would have had to restrict it because we thought they would have known better. But they didn't know better. In some cases, not in all cases, obviously. Some people did an incredible job. They built plants all over the country. I mean, you'd see what's happened. I mean, we were doing, until this invisible enemy appeared, we never had an economy like this. But there were some companies that used that money to buy back stock, driving up the price of the stock artificially in many cases. I don't like that. I don't like it. And as far as whether or not we'll have that, allow them, when we give them money, because we have to keep these great companies in business because of the workers. Frankly, for the most part, because of the workers. The workers are my number one concern. But the way we take care of the workers is we have to keep the companies going. I am fine with restricting buybacks. In fact, I would demand that there be no stock buybacks. I don't want them taking hundreds of millions of dollars and buying back their stock, because that does nothing. Yeah, please.
Thank you very much. One for Dr. Fauci and then hopefully one for you.
Sure. And one thing, Secretary of State Pompeo is extremely busy, so if you have any question for him right now, could you do that? Because you know what I'd like to do? I'd like him to go back to the State Department, or as they call it, the Deep State Department, if you don't mind. I'd like to have him go back and do his job. So does anybody have any questions?
Ooh, was that just a shot across the bow at Mike?
Yeah, how about you? Only for the
The
secretary.
exemptions on work travel, can you define that? Is all work, anyone with a work visa can still cross the border? Can you define what, like, the measures that you're taking?
It's a great question. We're working, we're very real concerned about H-2A visas, in particular agricultural workers need to get across. We're going to make sure that we do everything we can to keep that part of our economic lifeblood, working between our two countries. DHS and the State Department will work together. We want to make sure and keep commerce between Canada, the United States, and Mexico alive, functional, and prepared for the day that this economy bounces back like we expect that it will.
Mr. Secretary, the Mexican government has not announced any travel ban on Europe. Where have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or sent back from the U.S.?
If I may, I'll take the first one and then Chad, I'll give you the second one. With respect to travel into Mexico from outside, I spoke with Foreign Minister Ebrard a couple of times about this. I'm very confident we're going to get to a really good place that protects the Mexican people and the American people from those who might be traveling into places where we've got designations, the Schengen zone from China, so that they're not coming into Mexico and then coming into the United States. I'm very confident we'll do that, and we'll make that announcement shortly together.
And again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back as well as other populations.
But are you sending Guatemalans back to Guatemala or Cubans back to Cuba? What would you do with those third countries that are not Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to the Northern Triangle countries, Cuba, Haiti, all of again, 122 different nations that we see nationalities that come across that border. We'll be sending them back individually to their countries, but also working with Mexico to send additional populations back there as well.
I don't trust the CDC either, abandoned.
You said the non-Mexicans going to Mexico. We're not sending them to Mexico. We're sending them back to their own countries, not to Mexico. Why would Mexico take people that aren't from Mexico? We're sending them back, in the case of Guatemala, Honduras, El Salvador, a lot of other countries, they go back to the country from where they came.
He's reuniting families.
Secretary Pompeo, on the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
It's pretty diffused, unfortunately, but we've certainly seen it come from places like China and Russia and Iran, where there are coordinated efforts to disparage what America is doing in our activity to do all the things that President Trump has set in motion here.
Other than what you're doing this morning, what are you doing to fight back?
Lots of things, lots of work. One of the things we want to make sure is the American people go to trusted sources for that information. But we've made clear, we've spoken to these countries directly, that that they need to knock it off, that we don't approve of it. And then there are a handful of other things we're engaged in to make sure that the right information is out there and accurate information is given. This idea of transparency and accurate information is very important. It's how we protect American people from something like this ever happening again.
Mr. Secretary, the Peace Corps volunteers.
You want the American people to be coming to trusted sources of information. Does it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
Somebody else have a question?
Peace Corps volunteers have the Peace Corps volunteers.
Secretary.
Please.
Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them?
I appreciate that question. So we're doing lots of things. We've had a couple places in particular, Peru and Morocco. I think we've had the first 2, maybe 3 now flights out of Morocco. We're going to work to get people back. We're urging individuals when they can get back on their own. They traveled there on their own. When they can get back there on their own, they ought to try to do that. But we have a team stood up at the State Department, the Repatriation Task Force, that is working each of these instances. So we've heard from individuals, members of Congress. We're trying to get Americans back from these places where air travel has been disrupted. And we'll get that done over time. We'll get it done
Do
successfully.
you have any sense of how big that problem is? Is there any sense of just how big that problem is? How many people?
We don't know the full scale of it yet, but we think we have the largest number identified, and we're working. If there are those who are watching that are someplace, and you can go on the State Department website. You can log into, I think it's step.gov. You can go to STEP and log in, and we'll track it, and we'll try to get everybody back just as best we can.
Secretary, how long are these border restrictions likely to last along the south and north borders?
Well, they'll last as long as we need to do it to protect the American people.
Hopefully 20 years.
I couldn't tell you how long it's going to last.
Have you determined whether Iran is responsible for that rocket attack last week?
So
Maybe we shouldn't say that.
So let me just get back to you on the answer to that. And what we can say with certainty is this: we've made clear all along
Yes,
that the
that's
Iraqi
what
Shia militias are funded, trained, equipped by the Iranians.
So that
We've
means
urged
we're
the
planning
Iranians not to do that, and we've
a
told the Iranians that they will be held responsible for those attacks when they threaten American lives.
So we're planning a response on Iran, is what he just said right there.
The Peace Corps volunteers that are in 60+ countries, have they all been returned?
I don't know if they're all back or not yet. I know that they were directed to come back. I know that most of them are back. I couldn't tell you if we have all of them back yet.
And
I
then
don't know.
Secretary Esper's not here, but to get tests to the troops in Iraq and Afghanistan, are you able to give us a progress report on the status of that, if they're all able to get tests?
I don't know the answer to that. I know we have State Department officials, too, who are concerned, want to make sure we get them tests, our team as well, and we're working on that. We've had significant success on that to date. There are a few places we've not been able to get them, but we will. We'll get them there.
Secretary Pompeo, how exactly are you going to get those Americans back, and do you have any plans to get the military involved in that?
We're going to use all the tools we can. These first efforts are combined commercial, private flights that will fly in, bring them back to a destination here in the United States. So we'll do that. There are some that will travel back other ways as well. And we've worked with the Department of Defense to say where there is space available, we'll be able to bring them back on those flights as well. It's a whole government effort to make sure we get them back. They're gonna help us every place they can. Secretary Nesbitt, I've talked about it a couple times.
Thank you, Secretary. Question on Iran again. Is there any consideration to relax some sanctions on Iran during the coronavirus crisis instead of being particularly hard hit?
That's an important question. The whole world should know that humanitarian assistance into Iran is wide open. It's not sanctioned. We've offered to provide assistance to the Iranians as well. I talked with Dr. Tedros from the World Health Organization about this. We're doing everything we can to facilitate both the humanitarian assistance moving in and to make sure that financial transactions connected to that can take place as well. There is no sanction on medicines going to Iran.
Okay.
There's no sanctions on
Well, that's
humanitarian
good.
assistance going into that country. They've got a terrible problem there, and we want that humanitarian medical healthcare assistance to get to the people of Iran.
But the sanctions themselves, no movement.
We are working to do all the things we've had in place for the first 3 years here to deliver security for the American people.
They know the answer. Iran, they know the answer. Iran, the leaders, they know the answer to your question.
For the president to call your department the Deep State Department at
Ooh.
a time when thousands of diplomats are working very hard around the world
Ooh.
to combat this
Now
pandemic.
she's trying to
Worked
send
with
some
the president for 3 years now. I know how much he values the people that work on my team. I know when I was the director of the Central Intelligence Agency how much he valued the work we did. I know that he watches our team, Dr. Birx, all the team that's working to push back against this virus to keep America safe. I know how much he values them.
What a good answer. Yes, go ahead.
Mr. President, can I ask a question? Mr. President,
Very true, too. Go ahead.
Mr. President,
No, behind you.
I apologize.
Please, go ahead.
The news, I have two questions. The first is to Secretary Pompeo. The news hours learned that the CDC picked up that there was some sort of virus happening in Wuhan, the coronavirus happening in Wuhan as early as December.
This chick, I
When
can't
did the
stand her.
CDC start letting other agencies know that there was something in China happening, that this coronavirus was happening? And then when did the whole government approach start to happen?
So I'll let the CDC or Dr. Fauci, you want to talk to that? Yeah, Dr. Secretary Azar, please. Yeah.
Yeah, so we were alerted by some discussions that Dr. Redfield, the director of the CDC, had with Chinese colleagues on January 3rd. It's since been known that there may have been cases in December, not that we were alerted in December.
Then, Mr. President, the other question I have for you.
Excuse me, we'll do it in a second. Let Mike.
May I just say one more thing? There's been some discussion about China and what they knew and when they knew it. And I've been very critical. We need to know immediately. The world is entitled to know. The Chinese government was the first to know of this risk to the world. And that puts a special obligation to make sure that the data gets to our scientists, our professionals. This is not about retribution. This matters going forward. We're in a live exercise here to get this right. We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. It's an imperative to keep people safe. We talk about the absence of data sets, not being able to make judgments about what to do. This is absolutely critical. This transparency, this real-time information sharing isn't about political games or retribution. It's about keeping people safe. And so when you see a delay in information flowing from the Chinese Communist Party to the technical people who we wanted to get into China immediately to assist in this, every moment of delay connected to being able to identify this the risk vectors creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
Mr. Secretary, what message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
Because you get stuck.
I've had my frustration with reporters too. All I ask when I talk to the media is that you listen to what we say and report it accurately, and it's frustrating. It's frustrating when you see that doesn't happen. It's enormously frustrating. We have a responsibility to tell the American people the truth, and those who are reporting on what it is we're doing and saying have an equal responsibility to report accurately.
What message does it send to countries when you're lashing out at reporters?
Being reported, that the news media
I've seen many things at the State Department be reported wildly and accurately on multiple occasions, and I have spoken to those reporters about it each and every time, and I will continue to do so.
Mr. President, Senator Johnson has suggested.
Well, I'd rather have, if you could finish up with the Secretary of
I
State.
think I've worn them out, Mr. President.
Well, let me
Is
ask
everybody
you both.
finished, Secretary of State?
Let me ask you both, if that's all right. Mr. Secretary, Senator Johnson has suggested that you and the administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about.
Well, I can just say the entire world is agreeing with us because they all have their choice, and everybody's doing the exact same thing. We want to shut it out, and we can do that, and we'll see what happens in 2 weeks and 3 weeks.
I think it's because it ultimately has a bigger
We can save
effect.
thousands of lives, and even millions of lives.
It's a bioweapon,
potentially.
so-
you don't know where it goes, but you could be talking about millions of lives. So,
I think they know some
if you
long-term
look at
effects of
the
this.
world. I mean, you have
We're
some
just
very
looking at the
smart
short-term
people in the world.
effects.
You have some smart leaders in the world, and everybody's doing it the way we're doing it. I think we're doing a better job than hopefully most, if not all. We're doing a very effective job, but we'll know better in 14 or 15 days. But, you're talking about hundreds of thousands, and maybe more than that, numbers of people. And, we can bring our finances back very quickly. We can't bring the people back.
Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down, I don't really need to stay away from stores, I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
Yeah, I
isn't
agree
it?
with that. But I think I'd like to have Anthony answer that, because to be honest, that's what he does. And we had a lot of very talented people telling us what they think we should do.
Thank you, Mr. President. First of all, I think that's a false equivalency to compare traffic accidents with, I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and let X% of the people die? I don't understand that reasoning at all.
Okay, so Secretary of State will be leaving. Any other question? Go ahead in the back, please. In the back for Mike.
Thank you, Mr. President.
Excuse me, I didn't call on you. Go ahead, please.
Thank you, Mr. President. Two things. In New York, where cases are doubling every day, they fear that supplies are going to run out in a matter of weeks. Yesterday, Mayor Bill de Blasio called on you to mobilize the military to deliver urgent supplies. Yesterday, he said, quote, "The fate of New York City rests in the hands of one man. He is a New Yorker, and right now he is betraying the city he comes from." I've personally spoken to emergency department nurses who say that they've been told not to wear N95 masks because supplies
Cuomo
are
said
so
that or
low.
Blasio?
So how do you respond to those remarks by Mayor de Blasio?
Well, I
And
just
those
think
nurses
this.
and doctors looking to you, when will those supplies arrive?
I'm not dealing with him. I'm dealing with the governor, and the governor agrees with me, and I agree with him. So far, we've been very much in sync. I guess they're not agreeing with each other necessarily, but the relationship with New York, I love New York. I grew up in New York, as you probably have heard, and the relationship's been very good. And I think government and the governor have been getting along incredibly well with the federal government. Okay.
Question for Secretary Wolf, if I could.
Correct,
Just
Woodchuck.
on illegal entries of people who are OTM, how will the turnback process work? Will they be taken to a common area and then put on a plane and sent back to northern countries or others? I mean, how would that process work?
Again, it's a public health crisis, so what we're trying to do is limit the amount of contact that we have with these individuals, not putting them in Border Patrol facilities, ICE detention facilities, and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very quickly. It won't be the 6 or 7 or 10 days that we currently have. It'll be much more rapid.
But if they are OTM, will they be taken to an airfield
That's
nearby?
correct.
Or?
That's correct.
And sent back home?
Absolutely.
Anybody?
Mr. President, can we ask
Mr.
about
President,
the checks,
the checks
sir?
to Americans.
The checks to Americans. The bill as proposed creates sort of tiers of checks for incomes. Do you believe
it will be.
philosophically
Well, we're
that
working
makes
on-
sense?
Well, I believe in a lot of things. I want to get workers' money, and whichever way, the best way to get it. And I want to keep the businesses open too, because without the businesses, they're not going to be getting money for very long. But we're going to be
bill,
talking.
as it's written. Is there enough, or do you want
If
to see
there's
it
not,
juiced
we'll
up?
do something later, I'm sure. I'm sure we'll do that.
Wall Street analysts are predicting that unemployment numbers could skyrocket next week. By some analysts, say as many as 3 million people applying for unemployment, which would be a historic number in a 1 week spread. So is $1,000 check going to cut it? Is that going to be
We're
enough?
not talking about $1,000 check. We're talking about much more than that. We're also talking about doing phases. If this doesn't work, we're going to keep doing until we get it going. And frankly, once we get the economy back, and once this enemy is defeated, the invisible enemy, as I call it, once it's defeated, we get the economy
invisible
back.
enemy.
It's going to all come back to us very quickly. It comes back very quickly. We have a tremendous economy. We do numbers like no other country has ever done before. #1 in the world, if you go back 2 weeks, and still, obviously, but if you go back 2 weeks, #1 in the world by far. That money comes back to us very rapidly. We want to keep it, we want to have it so that when we, not if, but when we win the war with the invisible enemy, when we win it, these companies can immediately start. Not that they have to start rebuilding, which takes a long time. Steve?
Confident that those are
Steve,
jobs that'll
please.
come back if someone applies for
I'm
unemployment next
confident.
week?
What projections for job losses in March and April are you hearing?
Well, we're looking at different
It's
numbers.
ugly.
We have a best case and a not best case, but the big thing is to defeat the virus. Once that virus is defeated, Steve, I think everything else falls in place very rapidly. I think you're going to have a tremendous upswing.
It's probably going to be 70, 80%
A lot of-
unemployment if this
If you look at
continues.
your stock market geniuses, and some of whom are not geniuses, but they think they are, a lot of people think that I'm right about that once we defeat the virus, I think you're going to have a very steep, like a rocket ship, it's going to go up, and everything will be back. And I really believe we're going to be stronger than ever before. Yeah, go ahead.
President, on the issue of supplies, you've told governors to try to find whatever supplies they
Yeah.
can on their own.
Absolutely.
But some of them are now saying when they go to try to buy them, they're being outbid by the federal government.
Well, you heard my news conference yesterday. So not
Those
that- I mean,
governors to
that
do.
was sort of yesterday's news. No, that does happen because they want to buy supplies. We want to buy as a backup to them in case they can, and sometimes that will happen. But regardless of who gets them, when they need them, we're getting them to them. Now, we're doing the Production Act. We're doing it very much, and we have a lot of things cooking right now at a high level. Remember this. Nothing like this has ever happened before. Over 140 countries. And you have supply chains that are broken down for two reasons, because they can't supply that much and because people are sick and they can't be on the chain. So you have a lot of interesting things all over the world. You have supply chains that broke down because of the illness and also because of the fact, the quantity. But we're getting it ordered, we're getting it done, and if you just have to, look, some of you were at the call yesterday where I spoke with the governors, almost all of the governors, and every one of them was very impressed with what we've done. Go ahead, in the middle, please.
There are reports saying that the Labor Department has told states not to disclose their unemployment numbers. Do you agree with that decision?
I'd have to talk to him. I would have to talk to him.
One more clarifying question, if I could, on the DPA. I just want to be clear. Are you saying that the administration is requiring these industries to create these products, or just asking?
You know, so far we haven't had to. It's an amazing thing that happened. We're getting calls from automobile companies. We're getting calls from other companies saying they have plant capacity. They want to make ventilators. They want to make other things. We are literally being besieged in a beautiful way by companies that want to do the work. They want to do the job. They want to help us. They want to help our country. So we haven't had a problem with that at all.
President, how do you help out states and localities that are trying to bid on things like ventilators and other items that are being outbid by the
Well,
federal
when they call us, they let us know. If there's a conflict, they will call us and we will drop our bid because we want them to go first because they're point of sale. So we've had 4 or 5 instances where literally that was happening because, you know, we're both trying to get stock. And if we're going against, they will call us. The smart ones, frankly, will call us and we will immediately, we want them to buy it because it gets to them quicker if they buy it.
Do they know that they're
We're
able to
really
do this?
there. They know that, and it's happening more and more where they're calling and they're saying we're bidding against each other. They want to get it; they'll get it much quicker that way. Go ahead, please.
Mr. President, a question for Secretary Azar. There are labs across the country that don't have the testing supplies they need. What specific actions is
What a
the
rocket!
administration
Have we not been
taking?
talking about all this, you rocket science?
Specific actions
We inherited
are
an
being
obsolete
taken?
deal, and we made a good thing out of it. I haven't heard that question in a while, but go ahead.
Yeah,
Why don't
so,
you-
so first, we're making tremendous progress in terms of lab testing. Tens of thousands of tests are being done every single day, both through the CDC and the public health labs, as well as now through the private sector commercial labs. They're getting to scale. They have supplies. They have high throughput. We do hear anecdotally, occasionally, of, say, a public health lab or another one that has a concern about this supply or that supply. Through FEMA, we actually are standing up a laboratory task force to answer those questions. Usually it's that the lab people do not understand that there are actually alternative supplies in the marketplace that they are perfectly free to use. We've actually had to put out some common myths and truths about that.
I
For
agree,
instance, the
Big
other
Sky.
day, we were getting calls from governors saying, we don't have swabs, there are no swabs, there are no swabs. Our supply people went in the open marketplace and bought 200,000 swabs in the open market, and I just sent a letter to every governor sending them swabs. So some of it's just they aren't listening or checking with us about all the freedom, all the capacities out there. It's a complex system with 330 million Americans and all of these labs. So sometimes there's a lab that doesn't understand how much flexibility they have and how much supply there is out there. And we're working through the new FEMA Integration Center to help correct that for folks.
Secretary Azar.
Be happy to.
How well that's working.
Well, as I said, more and more tests are being performed every day. And as we learn about the results that are being reported around the country of coronavirus tests, our experts continue to look at the numbers and see that some 90% of Americans that are tested
I've
do
watched
not
him
test positive for
this
the
last week,
coronavirus. And so it can
Pence,
give
and
you
he's
a
just,
sense of the
"Well,
magnitude of
it's
testing
just
that's going on.
world's
We have
burning
a
right
number
now.
of cases
It's all okay.
that we've reported
It's
today,
so-
but it's
I'm
it's
very
in
politician-y.
some cases near to 10 times that
Talk
have been
about Mr.
tested.
Chill
But let me
pill.
also emphasize how important it was in answering these questions for governors and local officials that the president stood up FEMA and the National Response Center, where we briefed governors yesterday. Now, every governor and their state health departments have the ability to reach out to our regional FEMA administrators. And that's how, as the president said, we're sorting out those potential conflicts between very significant federal purchases
Thanks,
and
Tyler.
procurements and as hospitals and state governments are purchasing as well. I think the new streamlined system operating now in
And
all 50
alligator-
states in our territory.
and alligator meat for all my
governors and
subs.
states going
He's
through
gonna
their
kill some alligators, make
regional
us some boots.
administrator for FEMA is going to
Feed
make
us
it
some
more
food.
possible for us to ensure that our hospitals, our healthcare providers have access to what's available on the open market and elsewhere.
Mr. Vice President, you're the head of the task force. You've seen the numbers. You've spoken to average Americans. You're a former governor. What do you say to Americans right now who are watching and who are scared?
I would say, do not be afraid, be vigilant. All the experts
Here
tell
comes the
us
rah-rah speech. Let's be
that
honest.
the risk of serious illness to the average American for the coronavirus is low. But we need every American to put into practice the president's coronavirus guidelines, 15 days to slow the spread, because the coronavirus is about 3 times more contagious than the flu, according to our best estimate. And you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome. That's the reason why we're encouraging people to avoid groups of
And the
more than
leftover
10,
effects,
not
guys, they're not
eat
telling you about. Even
in
if you
restaurants,
recover,
but to use
your lungs
drive-thrus,
can
to
lose
wash their hands on a regular
large
basis.
capacity of
And
their ability.
particularly, we're going to continue, as the president has directed us, to focus on the most vulnerable population, which are seniors with serious underlying health conditions or anyone with an underlying immunodeficiency. It's those people we need to care for, but it's going to take all of us working together to make sure they're safe.
Mr. Vice President, on the issue of
Get a
ventilators, Mr. Vice
clarification,
President.
because you just said that you haven't had to require companies to up their production of medical supplies. But you said last night you invoked the
but I didn't say that.
DPA. I'm confused.
When we
Are you
need
requiring
something,
them,
when we
or-
need something, because of the act, when we need something, we order something. And as you know, 2 days ago, I invoked the act, which was a big step. I'm not sure that it had been done before, certainly not very much. And when we need something, we will use the act. What has happened is, before we even go out, many, many companies, great companies, companies in a totally different business are willing to do things and make things, because that's what they do. They make product. They're willing to make product for us, medical product, that we need very badly for the states, that the states can't get, they haven't been able to get. And you know, most of the states, in no way did they do anything wrong. They were stocked up. They were all equipped. Unfortunately, they've never had a thing like this. So they need help from the federal government.
This is important. You haven't actually directed any companies to start making more ventilators or masks,
I
right?
have, yes, I have.
Companies.
A lot, and they're making a lot of ventilators, and they're making a lot of masks. Go ahead, please. Go ahead.
Mr. President,
Yes.
partially following up on that, are there automakers right now who are retooling their production facilities to make ventilators or
I can't say they
masks?
are, but they will be very shortly, because we're working with one in particular that wants to make ventilators. They called us yesterday, and we're working on a transaction. They're going to make ventilators. They say they've done it
Elon
before,
Musk?
which surprised me, but they can do it very easily.
Secretary
This is
Go
partially
ahead.
for you, partially for Secretary Azar. You said that you had spoken to
Who's the president, chairman, CEO, and owner. I
And
think
he
he's got
could
every
lend
title
some
he can
ships
have.
to potentially
He
be
said
hospitals.
he said to me that he was willing to, if we need ships for helping people, that Carnival would be absolutely willing to help us in Los Angeles, in New York, wherever they may be, in Miami, where they're very big. If we needed something, they would be willing to.
Am I
So
losing my
far, we
internet?
haven't needed to, and we're bringing the big hospital ships up in California. We haven't. We're working with the governor of California, as you know, with Gavin, and we haven't made a determination. We're also talking to folks who would like it in Seattle. So we're discussing where it can be most useful. We've spoken with Governor Cuomo, and we're bringing. Said if we need it, I'll let you know.
Okay.
That's called taking them up.
And secondly,
Right now, we don't need it.
cruise ships have a lot of frequently contacted surfaces, and so this is where you come in, Secretary Azar, potentially Dr. Fauci. Do you have concerns about the cruise ships being used as hospitals?
Well, I can tell you they're very clean, and also those surfaces, the germ, as you know, the virus disappears over a period of time, and these ships are very clean. They've been kept very clean. They've been gone over, but the virus, as you know, if it's on a surface for a certain, they have actually charts, different kinds of surfaces, it disappears over a period of
Why not
time.
just use hotels?
What are you trying to get at? Go ahead.
Well, that's what I'm asking. Why not
It
just use hotels?
disappears, the virus disappears when it's on surface after a certain number of days, or in some cases hours, depending on the surface it's in. Go ahead, please.
Thank you. A quick follow-up. So can you name any of the companies that you've asked to start making these ventilators or face masks?
I will be, but first I want to get the approval from the company, because I don't want to be doing that.
Okay, well,
I assume they'd like it, but I'll let you know.
Okay, well, thank you. And this is for Dr. Fauci.
I mean, one company that has openly stated it is General Motors.
So that's one of the, did
One of
the
the
government
companies, but
ask General Motors?
I didn't speak to them about announcing it, but I'll announce it. I'm sure they wouldn't be, but we have others also.
Thank you. And
Okay.
so for Dr. Fauci, there's new research out that the CDC has released that many of the people that that 13% of the people with the coronavirus got it from someone that was asymptomatic. So my question is, does that change the way the approach that should be taken? And do you think that's the case, or do you think that, or do you not agree with that research?
The recommendations that are here applies to whether you're in physical contact with someone who could be infected with symptoms versus asymptomatic. I don't really think it changes anything. Certainly, there is some degree of asymptomatic transmissibility. It's still not quite clear exactly what that is. But when people focus on that, I think they take their eye off the real ball, which is the things you do will mitigate against getting infected, no matter whether you're near someone who is asymptomatic or not. It's the same thing. Physical separation and the care that's outlined here is going to take care of both of those things.
Thank you, Mr. President. I have a question about testing. When
Coming back, different things.
guys.
You know
Okay,
them better
there it
than
is.
I do. So ready? We don't need that. But what we are having is these private labs have come in. They've been really fantastic. And we also have a great system for the future. Because as I said, we inherited,
Stock
meaning
market,
this
the Dow is
administration,
down 0.58.
an obsolete, broken system
Down
that wasn't
117
meant for
points.
anything like this.
S&P
Now we
is
have a
down
system
21
that
points.
you can see, because look, we're well into
NASDAQ
this
is up
and nobody's
6
even
points.
talking about it, except for you, which doesn't surprise me.
There are Americans, though,
Which
who say
doesn't
that they
surprise
have
me.
symptoms and they can't get
Yeah,
tests.
well,
What do
okay.
you say to the
I'm
Americans
not,
who are
I'm
scared
not
that they
hearing
have
it.
symptoms and they can't
But
get
we
tests?
don't want everybody to go out and get a test, because there's no reason for it. Yeah.
Americans who have symptoms
We'll do
and
one
can't get
more
a
after
test.
this.
Dr. Fauci, because Kevin Hassett is one of the people who is now suggesting that the real way to get to the end of this, for life to return to normal, is for every single person living in this country to be tested. That way you could see
Good
who's
afternoon,
contagious,
Lisa PC.
and you could then have people who don't have it go back to work. Is there any possibility that this country could ever get to a point where every single person could be tested, and how long would that take?
Thank you for the question. I've heard that before. I don't connect the dots there. I don't see how testing everybody in the country is going to help you to implement this. This should be implemented universally, at least at this level for everyone. The things we spoke about a while ago, that you want to really ratchet it up, like Governor Newsom is doing in California, like Governor Cuomo is doing in New York, or how you put an end to this outbreak. Testing is important. It would be nice to know, and there are certain things you could do. But let's not conflate testing with the action that we have to take. Whether or not you test, do this. I'm not putting down testing as an important issue, but people seem to link them so much that if you don't have universal testing, you can't respond to the outbreak. You really can.
But I do think, and that's after listening to Tony and everybody else that's an expert, I do think it's important that not everybody be tested. If you feel great and if you have no symptoms whatsoever, it's just not a good thing to be doing. All right, Steve?
A question for Dr. Fauci. Yesterday you mentioned the possibility of aerosol transmission of the virus. How likely is that to happen?
Am I
The
not
possibility
online
of
anymore?
some aerosol transmission. Aerosol means that it can stay in the air for a period of time because it's in a droplet that's very small and doesn't go down. Is it possible and that there is aerosol transmission? Yeah, it certainly is. But clearly, what we have seen in the situations where people have gotten infected from the areas that we have experienced, China, South Korea, now Europe, most of it is in a situation where people are close enough to each other that a symptomatic person will have a real droplet transmission. So I'm not ruling out the possibility that it's aerosol. But again, it's not going to substantially change doing this.
Dr. Fauci, quick follow-up on the testing issue. Let me just ask this in a very simple way. What is the demand pressure on testing in this country, and are we meeting it?
I get the same calls that many of you get, that someone goes into a place who has a symptom and wants to get a test, and for one reason or other, multiple, logistic, technical, what have you, they can't get it. That is a reality that is happening now. Is it the same as it was a few weeks ago? Absolutely not, because as the Secretary and others have said, right now that we have the private sector involved, the availability, not
I'm going
only
to go over
just
some thoughts when this is
availability, but the
done. So anybody wants to stick
implementation
around, we're
of the
going to have some
availability
notes. We're going
is
to cover
getting
some
better
little
and
post
better
press
and better.
conference thoughts.
Having
So
said that,
you guys can stick
I
around to the end. That'd be great.
understand and empathize with the people who rightfully are saying, I'm trying to get a test and I can't.
So is that a way of saying we are not yet at a point where we are meeting the demand pressure?
Well, the answer is yes,
do
John.
you
We are
think,
not
John?
there yet because otherwise people would be never calling up saying they can't get a test.
Well, I just can't emphasize enough about the incredible progress that we have made on testing. All of your reporting, and media outlets around the country are as well, that many, many more tests are being performed every day, literally by the tens of thousands. And this has only been made possible because several weeks ago the
The
president
test sucks
brought
too
in
because they got to
the
shove something up
commercial
your nose
labs,
like
these
5 inches.
enormous companies,
It's not a
Quest,
fun
and
test.
LabCorp, working with companies like Roche and Abbott Laboratories and Thermo Fisher, and said, we have this existing system of state laboratories and the CDC processing tests for certain infections. But given the magnitude of this outbreak, the president apprehended early on that it wouldn't be enough to meet the need. And I just want every American to know that literally hour by hour, in partnership with these extraordinary commercial labs, we are making more and more tests available every day. We'll detail the way that we're working with states to distribute those tests. We've obviously focused on states that have been dealing with the most serious outbreaks of coronavirus: Washington State, California, New York, and others. We've been making sure the tests are in those areas, working closely with those governors. But I think the American people should be encouraged at the progress that we are making. Tomorrow we'll take some time to detail that progress for you, but I would say to any American who might be concerned that they have symptoms, as the president said so well, we don't want every healthy American to get a test. But if people feel that they have symptoms that they identify with the coronavirus, call your doctor. Their doctor can call their state health authorities that can work very closely with our entire team through HHS and FEMA and work to identify the more and more tests that are available every day.
Okay.
Just so you know, just for the probably 100th time, this administration, inherited an obsolete, broken, old system that wasn't meant for this. We discarded that system, and we now have a new system that can do millions of people as you need them. But we had to get rid of a broken, old system that didn't work. It worked only on a very limited basis. And we're very proud of what we've done. It's incredible what we've done. And this system will now serve for the future, for future problems. Hopefully you don't have a problem like this, but something will come up. We have now a great system, and it's almost fully in gear, but it's able to test millions of people. But we inherited a broken, old, frankly, a terrible system. We fixed it, and we've done a great job. And we haven't been given the credit that we deserve, that I can tell you. But the one that really deserves the credit are the American people, because they are doing things that nobody thought they would do. What they're doing is incredible, and we're making a lot of progress, and we'll see you folks tomorrow. Thank you very much.
Okay, so I'm going to post that time there, and then we'll end it before I get out of here. So, okay, so let's go back to this screen right here. All right, so I have some definite things I'd like to cover or touch base on when it comes to everything we just heard. What's this? Keep this out of the way. No, dismiss that. Okay. So, where to start? Wow. Well, let's just jump in here on some of the notes I was taking because I think they covered a bunch of different things. Okay. This is crazy times we're in, guys. And the nice part about these press conferences is they always make us feel better, right? Because everyone's calm and everyone's like, take a deep breath. We need to just relax, which I think there's a lot to be said about that we do need to relax. I know I can get a little animated and I can get a little conspiratorial, or I can go off the deep end on some stuff, but I think it's not necessarily the deep end. I think it's just me starting to learn that I want to believe the president when he says that we're going to soar back, the economy is going to come back. But we are at Great Depression level, headed towards or really close to Great Depression levels. We're definitely this is going to cause a recession. For how long? I don't know. I don't know how long. That maybe it's the quickest recession recovery of all times, but this is undoubtedly going to cause a recession, and I think that's putting it lightly. I'm trying to fall up on the positive side of this. Excuse me. Sorry for that crunchy cough. It's gross, but clearing everything out. I feel fine, by the way. Still sound terrible. Feel fine. Our stock market, I don't know where we're at right now. I had it up earlier. Let me pull this up right now after the speech. So the Dow is down 126 points. The NASDAQ's now down 35 points. And the S&P is down 33 points. So not great news. Now, in a normal day, that would be like horrible. Like, oh my God, everything's down by X amount of points. This is actually walk in the park for us when we were talking. We've seen in the last several days, we've seen, it fall as far as, 3,000 points. I mean, it's been sort of ridiculous how far we've seen some of this stuff fall. You need to be prepared, right? We're rolling out, and we could argue. I know Doug Ducote wants to calm the fear. Of course, National Guard and the Army Corps of Engineers and whatnot, they get called out for national emergencies. We are definitely all right. Hopefully, this doesn't keep happening because now, right when I want to get to my thoughts, it's going to start. Oh, did it already kick me off? So it took me out of my clip that I wanted to make, my post clip. That's great. That's really great. Create highlight. Yeah, okay, no, that's still there. Okay, good. So at any rate, it's I don't even know where I was until when that disconnected. I hope this doesn't keep happening, but our government's there to make us feel warm and fuzzy and that everything is going to be okay, and that's their job. They should do that. I'm not really necessarily against that. Make sure I'm not distorting either, but because I don't want this to be distorting, I'm going to pull down a little bit. But here's the thing that he said. He started off by saying we're staying in a war footing for our safety. So we are staying in this war footing. We have the invisible enemy. We are going to see, so I was saying about martial law, we're going to see martial law or we're going to see the National Guard roll out. They're going to be here to help administer tests, help build hospitals, help so on and so forth, right? You know, and help kind of control, crowd control, whatnot. That's going to devolve when we break into the looting, when we break into people panicking, right? When they can't just go wherever they want to. And in places like New York where they're just stacked on top of one another, the stir craziness is going to happen. They're not going to be kumbaya like they are in Italy when they're stuck in their apartments for, you know, a week or 2 weeks at a time. That's not going to go all kumbaya. It's going to devolve rapidly and hardcore. And so there's fear there. Same thing with LA. Then you have the homeless crisis, right? And you have these people that there was trending on Twitter that, you know, when can we start looting? When does the looting start? You have this mindset of these kids that just are right for the here and now, don't give a crap about anything else. You see that with the way they go out to the spring break. They're not caring about this. They're saying it's no worse than the flu and all this other stuff. We don't know exactly how bad it is, and it isn't. Now, the reaction that we're having to this makes me think that, it's either they are completely pulling one over on our eyes to completely shut everything, to rip everything away from us when it comes to our constitutional rights and get us in a mindset and prepped for this state of a nanny state, right? And then where we can't meet. First Amendment, we can't, public meetings and all this other stuff speak in our mind, where they've been setting this up, controlling the internet, right, where they control what we think or control what we say, where they're going to put stopgaps in place for this kind of stuff. That's definitely also most likely going to happen. But the recovery of this is not, I think he's been very optimistic, and I want to believe him. And I'm not an economist by any stretch of the imagination, right? And I don't even fully understand that at those levels. So is it possible? Maybe in a happy world, right? Just this happy make-believe world we live in at times, it's possible, I guess. And I want to believe that, but I don't see that happening. I see this turning into a very many, many, many months prolonged situation of trying to rebuild the economy after this and trying to rebuild confidence in our markets after this. Now, the stock market needed a correction. The 28,000, 29,000, that was totally inflated. So it was a joke of an economy, or a joke of a stock market anyways. It was not a true stock market. It was way overinflated. So this is a correction to it. Maybe now that we're down around the 19,000, 20,000 mark, we won't see as many drastic drops, because that's maybe more realistically where the whole thing should be in the first place. But there's a lot of things, and I don't want to bounce too much around, that go to the timing of this, right? With all the CEOs stepping down and all these other things, we are going to go into a great, great recession for a little while. Now, like I said, I don't know how quick that recovers or if it does. I will always tell you, regardless of how bad the virus is, which in the beginning I was on the whole thing, this is nothing more than the flu. What are they doing? This is all a political stunt to take down the president. I don't necessarily believe it's just a political stunt anymore, because you can't take down the whole world. That's an upside to it. That's an upside to it for the deep state, which he joked about, which worries me. Why are you joking about that if it's such a serious thing? Why are you joking and smiling at Pompeo when you say that? That makes me question some stuff, and I don't know exactly how to word or I got to collect my thoughts on that before I air out any opinions on that, but that was troublesome. But the media disinformation, Pompeo talked about that. He talked about media disinformation. That is all set up. Every time you hear the media disinformation, there's too much disinformation out there. There's too many people are crashing these systems and crashing those systems because they're spending too much time online. That's all a setup. That's all a setup in my mind to bring it to the point where they are going to then pull the plug on certain things, especially if this continues to get bad and it continues to escalate, which it's going to. They're just saying a 2-week lockdown, basically, of stopping work for 2 weeks. I think that's going to turn into much longer than 2 weeks. We don't have our kids going back to school or anything until the end of April now, right? This is going to, when people start to realize, they have to slowly roll this out. They just can't come out and boom and throw it on us. They have to roll it out slowly to manage the panic. You have to manage the panic. You have to tell people, hey, we're going to pay for your mortgage and your insurance or your rent, and we're not going to shut your power or electricity off. You have to tell them that. And then a few days later, you tell them, hey, by the way, you're going to see the martial law rolling out. They're here to deliver food. They're here to deliver healthcare supplies. They're here to whatever. And they're not really going to get involved. There's still going to be local involvement or local enforcement by the police department who's going to actually take care of, any kind of law breaking or whatnot. They're not going to do any of that. They're just here to help, right? Then you hear stuff that speaking of law enforcement, the law enforcement says, oh, we're not going to arrest people anymore. We're going to write them a ticket if you're caught burglaring or burglarizing. So all of a sudden, these low life, these low life Tide Pod eaters that are just looking for a reason to loot, looking for a reason to be a vandal, looking for a reason to riot. All of a sudden, now they're like, oh, cops aren't really going to do much for burglary and small things like this. They got bigger fish to fry about serious violent attacks and for things like that. So police departments throughout the country are rolling out things of like, we're going to write you a ticket. They did it here, saying if it's a non-emergency or it's a non-violent kind of a crime, send us in, write a report. We'll get to it when we can. We're not worrying about that. Now you add on top of that they're releasing low-level criminals out of the prisons for the threat of the virus spreading to them. So now you have more criminals back on the street. Now you have no food going into their mouths, and you have people in lockdown. And these low-life pieces of crap are going to take that opportunity when they get stir-crazy to go out and cause problems. Then that is the dominoes and the wildfire that has a fan blowing on it that starts to spread with great breakdown. And then when the great breakdown starts to happen in the society and the marshal, the National Guard and the troops are on the streets, that's when they start cracking down. And now you're not just having stay in your home, except for going to the grocery store and coming back, and more of a light, friendly, hey, it's shelter in place, it's lockdown. Now when this looting and stuff breaks out, you have a hardcore shutdown, hard curfew. You need to be in your house, papers, please. That's how this rolls out, right? That's the potential of this rolling out. Now, am I 120% sure that that's how the rollout's going to happen, or that's how bad it's going to devolve to? No. I'm not, and that is me best case scenario, right? We've never seen this, so maybe I'm jumping to the extreme. Do I think that is what's going to happen? I personally think that is how bad it's going to get. I personally think we're going to see a complete breakdown, and I want to be wrong, and I want you guys to make fun of me later and say you were wrong. But obviously, I have right to be wrong on this in the sense that we've never been in the situation we are right now with this kind of panic and this kind of shutdown. So do I see that as a potential? I absolutely see that kind of stuff happening as a potential. And I am prepared for it. So I'm not as worried about this personally myself because I'm ready to hunker in place for a while. If you guys aren't, if there's anybody still out there thinking, oh, it's all going to be okay, everyone just take a deep breath. Everything's going to just play out here in a couple weeks. We're going to be back up. Everything's going to be getting back to normal. And we're going to be fine. If that's you, I would suggest you go and you get some supplies if you still can, right? Now they're starting to lock down and tell you what you can and you can't get already. Now they're already putting stipulations on you at the grocery store of how much stuff you can and you can't buy, right? And don't buy toilet paper for the love of the sweet Jesus in heaven, man. Don't just buy toilet paper. You can buy some, but that is not your main concern. I've done this, so I'm not as concerned about some of that stuff right now. But you need to be aware of that. We need to be aware of that. Or staying open, no longer sell out. Okay. Sorry. Okay, so I'm going to wrap up some of these too. I want to go through these points. I don't want to lecture too much because, anyways. So I want to just go through these points and then get to some questions too. It says they all have to praise. That's kind of Trump scripted. And I get why they do it. Man, every one of these things, they praise Trump so much. Everyone steps up. President Trump has done such a good job and without his leadership, blah, 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 blah. I mean, and I get why they're doing that because he's had such a hard time in the media. He's really pushing that, right? Because like I said, I get it. It makes sense. I understand why he's doing it. But it's funny how they're all very much... ask us, and men get it worse than women. Men get it worse than women. That was another thing that the doctor said, that they were showing that men get it worse than women. I think that points to another bioweapon, guys. I do absolutely believe this is a bioweapon, and that's what makes me think don't be unconcerned with it, right? Unless it was a bioweapon, which there's a theory out there that it escaped before it was really ready. Regardless, this is not a naturally occurring virus. This is a bioweapon, so think about that. A bioweapon is released on people, and it was used. Whoever knows, did China do it? Did we do it? Did some other foreign actor do it? I don't know all of that yet. Yes, I've had my theories. I'm starting to lean more back towards the China one. But regardless of that, this is definitely not a normal occurring flu, right? This was a bioweapon. So it attacks women more than men. That's one of the things I've heard too, is that you want to make the men sicker, right? Those who can work. Sorry, sexist. Not trying to be sexist, but it's a sex. You want to affect those who can work. You want to affect those who can defend your country, right? That's a great way to weaken your nation, is to take out your men. Sorry for all you feminists out there that's going to butt hurt you, but it's the fact of the matter, right? We need both men and women, but let's be real here. Let's be real. There's no time for political correctness. Men really do help this country go and make this country run. So, as do women, but on the actual working of, physical and protection and, building stuff, men do that more than women. So, it affecting men, I find, as an interesting point, right? Side note. Como locked it down in New York. So we talked a little bit about this, Como locked it down. There's Twitter hashtags trending that are talking about when's the looting going to begin. Local authorities, you're going to listen to them. So when they kept asking them about, are you going to do a national lockdown? The way this martial law works, and Doug covered this really clearly, is that the local authorities, the state authorities, get to decide when they call up and when they activate their National Guard. So the local authorities have more of the call right now, and the federal government is just kind of letting them be, or letting them make the calls. But ultimately, they could push for we could federally have the feds come in and the federal government take control over everything if we get into a higher state of emergency, if we get into a farther, a more drastic state of emergency. Not that there's different levels, but to where things completely to divulge, you'll have the federal government now stepping in too. I find it interesting timing. We're pulling back troops, or we're not doing the Operation Defender in the Europe anymore. We canceled that because of the coronavirus. So all of our troops that were going to do that exercise over there, that got canceled. I wonder where are they coming back here? Are they just staying there and just not doing the exercise? Or are we pulling them back? Are we pulling them back and positioning them here in America because of the chaos that could ensue? Here's the other chaos that could ensue, other than just the coronavirus. As we're in this state of emergency and things are going to hell in a handbasket, we are in an opportune position for some sort of a foreign attack. And as nice as the things President Trump was saying about China and that he gets along with the guy and all this other good stuff, China is taking a war tone with us. So is Iran. So is Russia. They're all taking this more so, I would say, China and Iran are taking a very war aspect with us. We're not cozy, buddy. I know Trump was saying that, President Trump was saying that, but that isn't the fact of the matter. If you really do the research right now on it and you look into it, there's some more heat there between us than we'd like to imagine and we'd like to talk about. The national lockdown. So one of the comments was the flu kills more people, right? Well, here's the thing, that as you do the research, the R naught factor, which is how contagious it is, and Fauci touched on this, is I've heard 3 to 10 times worse. So it's not, I think that was the low estimate at the 3 times. I've heard it's as high as 10 times more contagious through some different scientists that have looked at this. The residual effects is also worse. You can recover. They say, hey, many people recover. If this many people catch it, I apologize how many was blocked out there. I was talking about the reconnection stuff, or I was talking about the reinfection stuff, not the reconnection stuff. So we don't know exactly if you can re-catch it. Many people said you can re-catch it. So if you can re-catch it, and we already have this kind of a strain on round number 1, but round number 1 could lead to round number 2 or round number 3 with those same people. And when you catch it and you get better, your lungs get more degraded, and then you can catch it again, and then you can also respread it again. That's why I think these are the things they're not telling us about the disease, because it would cause mass fear and panic, right? So yeah, it's right now we're like, it's so low numbers, why are we freaking out? I think it's because they're not telling us what really is about this disease or this virus, how really this virus affects you. I think they don't want necessarily to let us know that. because of the panic that would ensue. And also I think that there could be something else in the works that they know is going to happen or about to happen. And they're trying to get, because they know they also don't want to tell us that, like he was talking about Iran, they basically are saying that Iran did this, right? I mean, that's all later on in the notes there. He was like, they all but said that. So now we're going to attack and retaliate on Iran in the midst of all of this, in the midst of this weakened state that we're in as a country. We're going to now flex our muscles for a few missiles that were shot at a base in Iraq, where we don't even need to be there anymore, and we shouldn't be there, and we've been asked to leave by Iraq, and we still are keeping our troops there. And now these, whether or not they're Iranian-backed, which we don't know, and they're not going to reveal that, this could very easily be a setup and a false flag, also blaming it on Iran. Not to say Iran is good or that they wouldn't do this, but it could be. Let's be realistic here. So, we're going to now respond to Iran and put ourselves in a position where we could be in a hot war with another country when we're dealing with this at home domestically. That doesn't make a lot of sense to me, and I can't believe or understand why we would do that. If there's not a drastic attack upon us or a drastic imminent threat where we have to use military force against another nation, why would we consider that right now? Why would we consider that with everything going on? Because if that happens and we do push back on another nation and flex our muscles, you don't think that they're going to think this is an opportune time for them to maybe take a run at us too, with everything going on, and how they wouldn't have to shoot a missile at us. They could, and I've been calling this, and I hope I'm wrong, hit us with a cyber attack, cause a blackout on the East Coast. Can you imagine if a blackout happened in New York City right now, or in California and LA, with everything going on right now? Can you imagine the chaos that would ensue? Okay? And then that chaos, it's a domino that goes down and down. We lose more liberties because they're going to crack down on us like hardcore. So it's a win-win for the deep state. Also, we are put into a perpetual state of war then, right? Domestically, and we could possibly be thrown into a world war. I know this is fear. People are going to say you're fear-mongering. No, this is all very real that could happen. And we're in a position now where not many other shoes have to drop for that to happen, or they could drop very quickly and that could all happen. I'm being very realistic when I say that, okay? I'm being very, very realistic when I say that. Not trying to scare you, but just saying be prepared that this kind of terrible stuff could happen, right? So it doesn't catch you off guard and you're like, wait a minute, I thought Trump was just going to arrest all the bad guys and everything was going to go back to normal. No, you can't be living in that fantasy world right now. If that happens, I will be so happy that I am an idiot and you were right. But you can't. You gotta plan. Which mistake do you want to make? Which mistake do you want to make? So, the chlorine malaria drug. I found that kind of interesting. How they tried to correct it and show at the very end there, Trump and Fauci, that they were on the same page, basically saying the same thing. They weren't saying the same thing in the beginning. Trump was like, I like the idea, and Fauci's like, whoa. Which makes me wonder, is it because we don't want to give too much hope to people right now? They don't have any problem spreading the fear or spreading this complete breakdown of everything around us and pulling literally everything down over a possible, which they're not telling us, but just as we can see, over a possible little fear of a virus that could, kill this many people, but really people get over it. This is what we're being told, although I think it's worse than that. They don't have problem stopping everything there, right? But why wouldn't we at least want to tell them the hope that, the hope that this disease or this drug could help? So that was interesting, the disagreements that they had on that point there, and that Trump was like, I have a great hope for it. Fauci going, I don't know. Now I know Fauci has some deep, I don't know about Fauci. I don't know, so I really like much of what he thinks, but so, but then again, Trump's wanting to not spread panic right now too. So, Trump putting person in place. I am the worst case prep, best case. Trump putting person in place. Oh, Trump putting his that was awesome when he put the chick in place, that reporter in place. Kind of what everything I've been saying here. I want to believe I'm preparing for the worst and hoping for the best. They said it has a very low incidence of death. Well, all of our numbers on that came out of all of those numbers were coming out of China, right? So we don't really know. We don't really understand what's been happening in China and what hasn't been happening in China. We don't really know that yet because we don't really they have all that locked down. Italy, many are dying, right? And the people that are, and many young are dying, and it's falling out of that set who they said is and isn't dying. So it's falling out of that. Also, on top of all of that, you have to add to the fact that you're left with, many people are saying you're left with lung damage after this, right? So it isn't just those who are recovering. You got to keep that in mind. It has the potential to weaken your immune system is what I'm hearing and leave you with lung damage. So even if you recover, you're not fully the same. So there's something to be considered about that. Again, that's why I don't think they're fully telling us everything that's going down. He says he finds them honorable. Corruption of selling stocks. Oh, the whole finds them honorable stuff. When he's talking about these pieces of crap that either had foreknowledge of what was going down, which is very suspicious, and then short sold their stocks, right? And made all this money, Republicans, Democrats, and all this. And now he's like, but I find these honorable people. I don't know what's going on, but I find them honorable people. That's like kind of where that bothered me that he said that. It's like, why can't you call a spade, man? And if there were these pieces of crap that did that, I would come out and say, well, we don't know the facts, but if this is what they did, this is disgraceful. This is disgraceful, and we are going to get to the bottom of it. But instead, he kind of downplays it and is like, well, I find him honorable. And he wanted to get off of that question and get away from it. And that bothers me a little bit, if I'm totally being honest. That's like, what? Wait a minute. I don't know how to take that or what to think about that. Was that Chinese? And then we had that Chinese spy in there, that Chinese chick talking about just totally going after him and saying, hey, you knew about this in January and you didn't do anything until February, and nobody knew how bad it was in January. We were starting, the conspiracy theorists did, I guess. But some of these other people were like, oh, probably will come and go. We don't want to overreact. And I think Trump took his actions as soon as he figured out, oh, this is bad. I think he's done as best as he could with that. But she was like, what, a commie spy? And it was funny. Somebody in the comments said, is she tested? Was that Tyler or was that Kenneth? I don't know. Bailouts not liking us being okay with it now. It's so funny that we were totally against bailouts when Obama was doing it, but now we're okay with it because Trump's doing it. I understand what we have to do. This is an unprecedented situation. So I would say that's the only difference to when I look at it. I look at it with a little bit of difference is that we are in an unprecedented situation with this. But we got to be consistent. We hated it when Obama did it. We hate it when the Democrats bailed all these people out. Now we're going to bail them out. I do like the fact that he's trying to bail out the American people. The fact of the matter is, guys, what we don't understand is you just can't print trillions of dollars of money and give it to people and expect that it isn't going to absolutely devalue your currency, absolutely devalue and turn your cause incredible inflation and cause your money to lose value. You can't just print this money out of thin air and give it to people and expect that it doesn't have a long-lasting hurtful effect on the economy. Most people don't get that. They just think they're getting money in the bank. They're getting money, cash in their mailbox right now. It's going to cause a yeah, there we go. We're going live again. Anyways, the deep state stuff. When he said the deep state, he goes, he's got to get back to the State Department. I like to call it the deep state department. Bam. That was another shot across the bow at old Pompeo and in the deep state. But he did it with a smile on his face. Doesn't that bother you? It bothers me a little bit, if I'm being honest. It bothers me because if the deep state is so scary and terrible as we all know and believe it is, why are we laughing about it? Right? Why are we laughing about it? Why are we joking about it? Why is the president laughing and joking about it with somebody who is very much, in my opinion, part of the deep state? I don't trust Mike Pompeo at all. I don't trust Pompeo. So why are we laughing and joking about it? That kind of bothered me, man. And then the disinformation when Pompeo was saying to China, Russia, and Iran, knock it off. Measures are in place to respond, but you need to knock it off. We don't appreciate you blaming this on the U.S., and the deep state wouldn't like that if they're outing if the deep state was involved with this, which you can't put it past them because the deep state was involved with 9/11, right? I'm not saying that is for sure who did all of this or who's doing all this, but you got to understand the deep state did 9/11. Why wouldn't they pull something like this off, which was their wet dreams? This is their their Marshall, this is their authoritarian, totalitarian wet dream happening right now. Iran is responsible, talking about the bombs that we've been, or missiles have been shot, and we know it, he said. He goes, we know it, which is like, holy crap. So, like I said earlier, so now we're going to be responding against Iran, right? We're going to respond against Iran right now in this time. We're going to risk a full-on hot war of them seeing us at our weaker moment and attack us. And some people are like, America, man, we don't matter. We're still strong. We can do it. Really? You really think that's a wise idea? Well, you shouldn't just be focusing on what we're doing right now and not trying to start a hot war with another country. They shot a few missiles at us in Iraq. Bad. Okay, that's bad. But you know what's also bad? Us still being in Iraq. Us still being over there in Afghanistan. Us still being in Syria in small numbers. Us still being around. That's bad. We shouldn't be there. We should be home. We should have our troops home. If our troops weren't in Iraq right now, we wouldn't get missiles shot at us. We wouldn't be flexing against Iran. We wouldn't need to. Let's worry about our own plot of land. I've always said this. I will always continue to say this. If you screw with us directly and it's undeniable you did that, unprovoked, right? We should turn you into a parking lot. But we've been pretty... Stay here. Stay here. I'm almost done. Stay here. Stay here. Okay. Okay. I'm sorry, guys. We gotta get with this here. I gotta wrap up these points before I lose everybody completely. So just stay here. Stay here. Live exercise. What about that? What about the comment Pompeo made? This is a live exercise. We got to get this right. What do you mean this is a live exercise? This is a live exercise we have to get right? Was that a slip up? That's a big deal. Pompeo said this now. Could people like, you're reading too much into it? Am I reading too much into it when the world, when the martial law, when we have National Guard getting deployed, and we have Army Corps of Army Engineers is getting deployed throughout the America, when we have country or states being locked down right now like crazy, when we have, we're in a shelter in place, quarantining, when everything's going, the stock market is crashing, and he says, we're in a live exercise right now. We got to get this right. Deep state, Mike Pompeo says that. He throws in exercise, and we have to. I'm reading too much into that. I'm being a tinfoil hat. You're being a cognitive dissonant idiot if you think there isn't very well possibly something to that. And again, invisible enemy. We're fighting the invisible enemy. That's kind of convenient to have an invisible enemy that we can keep fighting for a long time. It's always an invisible enemy that we're going to be fighting, right? Just like there was the terrorists that could be anywhere. We got to fight them. We've been fighting them for 20 years. Now we have an invisible enemy. We got to keep fighting. Production Act. I need to read more into that. I want to understand more about what this Production Act means and stuff. But at any rate, I am under the... I don't trust anything and I don't know, and it's constantly fluidly changing. So any opinion I throw up today could change tomorrow. And I won't be held accountable to it, but I'll admit it if I'm wrong. Who cares? I'm not going to try to get everything right before I say something. I'm going to just say what's on my mind. Ultimately, you do have to stay calm. You do have to keep your heart in a place of peace as much as possible, but preparation helps you be peaceful. Being prepped emotionally and mentally and physically helps you to be peaceful emotionally, mentally, and physically. If you just think everything's going to be okay and everything's going to be all right, and you don't have any preparations in place, then you are not going to be in a good, peaceful state of mind when the shit hits the fan and you have nothing to do about it or to have for your family. So prep physically, mentally, and emotionally. And then when that time comes, you'll have more peace in that moment. So I am going to try to give some more live updates. We're going to do some streams with some of my friends and whatnot. So it will be a good time to, check in and, watch what we're doing here. Like I said, this is going to be something, guys, that all of the time is going to be fluidly changing. And so, okay, did that upload? Okay, so you just need to know that whatever happens, ultimately, it's going to happen right now. we can try to push back on this later, and the freedoms that we are losing right now, hope to God we're going to get them back. And if not, there may come a time, there will come a time in the future where we're fighting for them back. Right now is a time to understand where we're at, though, and that really there's not much we can do right now. Right now, you've got to kind of hunker down and get your thoughts right and figure out what your next steps are. Because things are, I think, going to get way crazier before they get any better. Now, and I'm also taking the stance of, I don't trust this virus, and I'm going to take my precautions. I'm going to wear my gloves and I'm going to wear my mask when I have to go out and do something. I may feel there's a huge part of me that thinks that it's kind of an I wouldn't say a huge part. There's a part of me that still believes there's an overreaction to this, and it's really not all that bad. But the other side of me is like, wow, if it is a bioweapon, which I believe it is, would it not be that bad? No, it'd be bad. Otherwise, it wouldn't be a bioweapon. And they're not telling us the whole truth because they want to keep us in a state where they can control us until they're rolling out whatever they need to roll out. They got to manage the panic. And then also I'm thinking they may know some other stuff that's going on geopolitically that they don't want to tell us right now. Because I do believe, and I'll pull this back, I think we're in a soft war right now. I think we're in basically with China, which also by default would mean Russia and Iran. I kind of believe we're in a soft war with them. Whether or not we prevail and pull back from this, I don't know. But they are speaking, you can call it disinformation, but they are speaking they're using words of war with us, right? They're saying they're pushing this conspiracy theory that America did this, which puts them in a war footing. We keep talking about war footing against the virus, but I also think that's programming in our mind that we're in a war footing right now, and we're just getting the American people ready and conditioned to that reality. Okay, so having said all that, let me open up DLive because I don't want to be a bad DLiver. I'm going to open up my DLive and I'm going to release the Krakens to the two people over there. If you follow me on DLive, you should have been there because I'm going to give out some lemons if I can get logged into my, where am I at here? Who's singing? What? Who is that? I don't know who that person is. I just went into for some reason, went right to my, okay, there we go. So, don't got a lot to dish out, guys. I don't got a lot in there, but I am going to distribute. Oh, wait. Do I need more? Submit. How many do I need? Add lemons to the chest to reward your... Oh, yeah, I'm going to add some lemons all up in there. Add some lemons. There we go. And we are going to distribute. It is distributing in 30 seconds. So, let me read some of the comments, guys. Because I know I just spurred it on for a while here as that distributes. I'm watching the case of reinfection also. If the numbers in China start climbing again, they are... since they are trying to get back to normal. So that's the other thing. China's not back to work, just so you all know that. China's not back to work, and the numbers that they're giving us out of China are a lie. Because there's been some stuff that's been, Lisi Peasy, you get them all. She gets them all. Look at that, Lisi Peasy. It's 52. That's 50 cents, Lisi Peasy. Don't spend that all in one spot. Anyways, no, I believe that they're still infected over in China, and they're just locking it down because I was reading a story out of the Epoch Times yesterday that says that in China they are still having lines outside the hospital. People who with other medical conditions trying to get in to do something in the hospital can't get in there because of the infection. They're still staying at home. And people aren't fully back to work, and school isn't back to work. So they are not fully uninfected there and in the clear. They still have cases. And then yesterday I just heard that China's now blaming the surge again that's starting to happen, or that the reinfections on people that have been repatriated back there from America and from the West are now causing new infections there. So they're not telling us the truth on that. China's not telling us the truth. If any women are upset by what he said, they should make a sandwich. Now you have on the target. Hey, I make a kick-ass sandwich. This is a valuable skill. This is. I didn't mean any women don't have skills. I'm saying the war skills and things like that, and the hardcore construction skills and some of those things. most of the army is men. So that it would target men is interesting to me. I am with the Bernie Sanders sandwich. I don't want to make my own. 10 days of dark. Well, I have to send the vegans to reduction re-education programs. That's funny, Tyler. A lot of bad fortune cookies. U.S. numbers were at 2.6% mortality rate as of 2 days ago. So that's pretty good. Now, we don't have all the numbers to know how many were sick and got better, but still, even just at that right there, it's a lot worse than the flu. So again, we can't compare it to the flu. I smoke 5 packs a day. You can't scare me with lung disease. Well, dude, you are going to be now one of the ones who could get it easier, Tyler. Stop smoking. Start doing Zyn packets like me. I got off those cigarettes a while back. I also thought about this being a deliberate release from China. They took steps ahead of time to contain the spread there. Their objective isn't death, it is economic destruction. No, I agree with you, Big. That's a very, very good point, and I think that too. Alicia said, I'm having some thoughts on Russia being involved. Putin was doing some weird stuff right before this. Yeah, well, I'm telling you, this is all, everyone knew this was coming way before this happened. And that's why people were trading stocks before anybody knew there was a panic. And that's why back in October, there was the, international, event 201 taking place. Everyone knew this was coming. This is a planned event. How bad the coronavirus is, we don't know yet. But all of the actions because of this are planned. This is a planned event. That's why I don't think it's just going away. This was a planned attempt. Now, we'll see how Trump responds and how he's responding, but I worry he's not in as much control as we'd all like to try and think he is. Okay? I have some theories I'll discuss later on that, but this is a planned event, right? I think China released it to prevent riot and possible takeover in Hong Kong. Yes, and that there was protests in Wuhan 6 months before all this went down. There was Wuhan, there was the Wuhanians, the people in the Wuhan province were protesting against China for their air cleanliness. It says, world corporations agreed to shrink the economies. They had a meeting about this and want to do and what to do in this situation. Yeah, this is 100% coordinated. Event 201, exactly, Fishhead. Targeting the retirees they can't afford to take care of because the government spent all the retirement funds. I also think that could very well play into this. I'm not kidding. Iran is using the AKs. We sold them in the 70s. Fisher said, Production Act is going to allow the government to us Americans forced labor to build weapons, etc. Very well could be. There was an awesome article I read yesterday about the math being potentially way overblown with the death rate. Overblown meaning more deaths or less deaths. I stocked up on cigarettes. Tyler, quit smoking. I'll put some stuff on your Discord. I found something interesting I screenshot from Threads. All right, Ford Nation, I'll look at it. Basically, if we took the official positive test with the deaths and the flu, we would get to 10% death rate. Yeah. See, that's what I've been hearing too, that the death rate's actually way higher. Does the Buzz Lightyear mask protect us against COVID? No, it does not. This will all a little be too convenient with the election and where the media was right before this dropped. I agree with you, Woodchuck. It's a setup, man, and it is a setup to take Trump down because he's not a globalist, right? I don't think he is. Maybe I'm wrong on that. Maybe we're going to find out through this we were wrong on that. I don't think I'm wrong. I want to be wrong. I want to be wrong on that, but I'm wondering, is he maybe part of that? I don't know. See, this is where I'm still whiteboarding and I'm a little confused, but it is all too convenient. It is all too convenient. Just FYI, I'm Alicia. I switched over to YouTube and came back when DLive came back up. Oh, okay. So that's cool. I think Trump is bought and sold. Question is by who and what is their goal? That could be Kenzie, and we don't know that yet. And I hate to say that because I put a lot of trust and faith that he isn't. But the possibility is he is. And I just don't know anymore. Or he is in over his head, and finally the deep state has used him for their purposes and is now pulling the carpet out from under him. he's not been as much control as they've given him this idea that he was really big man on campus, because man, he looks subdued. Doesn't he look subdued? And he could just be really tired, maybe a little sick, but he looks really subdued in these things. And so it kind of makes me wonder if he's realizing, oh, maybe he's been I don't know. Maybe he's now realizing I don't have as much power or pull as I thought I did. And that's kind of one of the things I'm thinking, is that the deep state has used him to separate America, to get us completely divided, right? To get to separate us, cause so many people to hate him, so many people to love him. I have loved him, and I'm not against him when I'm saying this. I'm just whiteboarding out thoughts that I'm working through right now. So if it offends you that I'm doing this and questioning anything, then this isn't the place for you, because I'm just questioning. I'm trying to be real. I'm trying to be honest. I'm trying to be true. I'm wondering where all of this is going. So, all right, guys, I've been going for a long, long time here, 2.5 hours. Yeah, what I'm saying is that the flu is potentially more deadly based on the same maybe they are using with COVID. I think Trump is bought. So, yeah, based on the same math, not maybe. I don't want to believe that Trump is bought out, but I can't rule it out either. Yeah, it's kind of how I'm feeling. So you'd be my wife. She's got a good head on her shoulders. Yeah. Our positive side effect is that tax deadline has been pushed back. Yeah, that's true. Yep, it gives us some more time to procrastinate. And it's also positive that you can sit back and enjoy your family and rebuild and take this time to prep and get your mind right and spend some time at home. Bills aren't going to matter right now. The economy's crashing so hardcore right now that all doesn't matter. So I will do some other stuff where it's more conspiratorial on some videos here coming up of potential bad stuff, because I always feel calm after these press conferences. Then I go back and I start reading what's happening in the real world, and not just the mainstream. I haven't read any mainstream media stuff at all. I have not literally read hardly any mainstream media, Fox, CNN, MSNBC. I'm not listening to them. I've been reading some trusted sources, and they're preppers, and they're not just Republicans or Democrats side. These are kind of more nonpartisan guys. And I've been reading their stuff. And I feel like, because I was reading their stuff back in January when they were telling this is going to get out of control in China, and everyone over here needs to be understanding this is something we've never seen. It's going to cause major, major disruptions and a big deal. Before anybody was even thinking about it or talking about it, I started thinking about it, and some of my older videos was talking about it a little bit too. And so those are kind of the people I'm reading, the ones that are ahead of the curve, right? Natural News, and Zero Hedge, and some people like that I think are ahead of the curve. Now, they get really scary at times, so you got to pull yourself back and balance, but I think they're ahead of the curve. So, all right, guys, I'm going to do a stream tomorrow with the guys, Drone Tech Robert and Dustin Gold. I think we're all doing a stream together, and then I'll probably do some videos later tonight, but I'm going to go in and have something to eat and talk to the family. So we will talk to you guys later. Have a great rest of your day. And until next time, without fear or animus, it's SJG Perspective. We'll talk to you guys soon. Bye.